At 7 p.m. I will call the August 17th meeting of the Pembroke School Committee to order. Just to remind everybody, the meeting is recorded mainly for the purpose of our minutes. We do post a recording from PAC TV. It is on Titan TV. We are live on Channel 14, and it does end up with a link to our website for anybody who wants to watch it afterwards. A couple things, just a couple housekeeping. So folks, first of all, can you hear me in the back? Okay, good, because
there are lots of seats
I'll
up
try.
front.
Yeah, there's lots of seats up front. Unfortunately, the air conditioner, if we don't have the air conditioner, then we'll all roast, but if we do, I have to speak much louder. A couple things, because I have a feeling most people are here for the superintendent discussion on DESE recommendations for return to learn. So here's how we're gonna go first to that on the agenda. So we'll open and go straight to that item, help out people. What we're going to do is we're gonna get a presentation from the superintendent, and to my left is Lisa Cullity, who's the Board of Health agent for the town of Pembroke. Those of you who haven't met Lisa, they're going to do a presentation on the superintendent recommendation, what Lisa has for her recommendation from the Board of Health. Then we're going to have the committee ask questions based upon that recommendation. Then we'll open it up for comment. If you wish to speak, because I know some people came in after we explained this, there is a sign-in sheet at the front. So if you can please sign in before you speak. I'll grab that right before we go, right after we finish the committee comments, and then I'll let anybody who wants to speak. You're allowed up to 2 minutes. You know, I'm not going to put anybody on a timer. Try to just use it judiciously. And if you do put your name on to speak and you would like to speak again, just please, if it's something new, obviously, please make sure we know it. Also, if somebody before you said exactly what you were saying, still come to the microphone, just state your name, I agree with the previous speaker, whatever, just so that we know that we heard anything that you have for concerns. We can't have it be a back and forth between folks out there. We want to try and keep this to be as good of a dialogue and as strong of a dialogue as we can. We know it's an emotional topic. We understand, we agree, we're all parents. We've all been in that parent position. We want to try to make sure, though, we have a good conversation so we get to a good decision process for your children. Does that all make sense? Is that all good? Okay. So with that, I'm going to turn it over to Superintendent Obie to start walking us through the presentation. Again, if you would like to, the sign-in sheet is on the seat right in front of me. Anybody wants, there's plenty of room in the front. Actually, one other thing. The microphones are for PAC TV, so if you do go to speak, please come to that microphone so they can hear you at home, okay? Just so that we'll hear you regardless, but they can hear you at home. And for the folks watching at home, I don't know what camera's on, if you do have a question or comment, we will take those through the end of the public comment period. So get those to scinfo@pembrokek12.org.
Yes.
Awesome. Okay. Turn it over to you.
Perfect. So I'm just going to do a little overview about what we're going to talk about tonight. Obviously, at the request of the committee, I will be providing them with the guidance from the Centers for Disease Control, the American Academy of Pediatrics, as well as the joint recommendations from the Massachusetts Department of Public Health, along with the Department of Elementary and Secondary Education. So for the first two organizations, those are national organizations that make a recommendation for all 50 states. They do not have the authority or the power to make a mandate for any one particular state. That is a local decision. So here is the CDC guidance. I know many of you in the audience, as well as our committee members, have seen this extensive document. This is just the takeaways from that. I'm not going to read you all of the information on the slides. The slides are meant to be posted to our website, so anyone that was unable to attend the meeting can kind of follow along with the conversation. So again, the CDC is advising universal masking in the K-12 educational setting. There is no distinction between vaccination or unvaccinated individuals. It is universal masking, as well as recommending that school districts maintain at least 3 feet of space between students at all times. Again, some of the overarching themes are the same in the CDC, as well as our DPH and the American Academy of Pediatrics, continuing to recommend that students and staff stay home at the first sign of illness, all of the things that we'll talk about as we go further into this report. Again, American Academy of Pediatrics takeaways are very similar to those for the CDC, again, recommending or advising universal masking for students in a K-12 educational setting. Again, both national organizations recognize that the primary mitigation strategy for COVID-19 is vaccination. So there are 2 organizations that have the authority to create a mandate in the state of Massachusetts for masking of school children. That is both the Department of Elementary and Secondary Education as well as the Massachusetts Department of Public Health. I'll let Lisa take the glory in the fact that our Board of Health here in Pembroke also has the ability to create a mask mandate for our local community. At this time, DESE is strongly recommending that all students in grades K through 6 are masked, along with all other unvaccinated individuals in a school setting. So that's unvaccinated teachers across the district, as well as students 7 through 12 that are unvaccinated. There are 2 instances of a federal mask mandate. The first one is on transportation. So any student that will be accessing our transportation, whether it's our traditional yellow school bus or one of our specialized transportations like a sped van, are required to be masked on that van. The second instance of a universal federal mask mandate is in our health offices. Students and staff members must be masked at all times within our health offices, regardless of the reason why they're there. So if students get medication from our nurse multiple times throughout the day or even once through the day, anytime they enter the nurse office, they must be masked. At the request of the school committee, we did reach out to the community for feedback on these topics. The first question, well, I'll talk about the survey respondents. So we had just about, I think it was 1,900, oh, I'm sorry, 1,200 responses.
Somebody just said, are we on channel 14 right now?
Pardon?
Are we on channel 14? Somebody just texted me on I got it through my app.
Yeah, we're on YouTube, so I know that.
We're on YouTube, but okay. Okay. Thank you.
So we had just over 1,200 responses to our survey. We did send the survey out to the entire community, so that includes students, staff members, parents and caregivers, as well as community members for their feedback. You can see here on the left-hand side the makeup of our respondents. About 80% of those that responded were a parent or caregiver. We had just about 11% or so staff, 7% students. Those are always the nicest comments to read. Our students are very thoughtful and creative when they take our surveys, so I'm thankful for all students that took the time to venture onto the survey and to leave us their feedback. On the right-hand side here, the primary purpose of the survey was to get community feedback on the DESE recommendations. So my recommendation to the committee is to follow the protocols set forth by the Department of Elementary Secondary Education as well as the Department of Public Health. The school committee was looking for feedback from the community on that stance. So we asked folks if they would be in support of following the protocol set out by DESE and DPH. So here in this graph that you can see about 63% of those that responded were in favor of the masking protocol set out by DESE and DPH. We had just under 30% that were not comfortable with that. And then we did allow an other category, and I'll say we learned from this experience that other is a very difficult category to have when it's open-ended. So there was a lot of comments in the other category. So I did go through each of those. I think there was about 78 other designations and read the comments to see whether it was a particular piece of the mask mandate or a particular portion of the guidance that they were concerned about. And so I did go through and categorize the other category. 3% of those in the other category were adamantly against masking of any kind. So they answered other as opposed to yes. And the remaining 3.9% were more torn between the different types of masking: vaccinated, unvaccinated, universal, pre-K through grade 6. So I think if you were to add the other back into the yes and no, you see it's about 2/3 for adopting the DESE protocols and 1/3 against that. I feel like I'm yelling. So I think though the survey was open to the community, I think the data point that the school committee was most interested in was the feedback from our parents. So taking the survey data and culling it out for just the feedback received from parents or caregivers. So we had just about, I think there was 966 parent or caregivers that responded to the survey. You'll see the breakout is pretty similar. Just about 66% were in favor of adopting the DESE guidance, which strongly recommends but does not require masking for unvaccinated individuals, and about 30% for no. Taking that even one step further, looking at the category of families that the DESE protocols affect, so our elementary families, if we take a look at the survey data for just those families, the survey was, again, the breakout is about the same. About 64% were in favor of the DESE protocols, 32% that were against, and another 4% that were other. Again, the other, there's a multitude of responses within the other category. If those of you that have been following this process since March 13th of 2020 know that we have done a lot of surveying, both from the school level as well as in, for feedback for the school committee. Generally, our survey responses are a third, and a third. So I do think there is an overwhelming number of those that responded that are in favor of the DPH DESE protocols. There was other questions on the survey, so I did want to share that feedback. When we post this document to the website for folks, in the appendix are all of the survey questions with all of the corresponding pie charts. But we did ask folks about a universal mask mandate pre-K through 12. You can see what those responses are. It was about 67% that were against that, 30% in favor, and then again the other category. The piece that we're going to talk a little bit more about later and the school committee was interested in feedback on is the test to stay protocol that has been outlined by DESE that allows those that are unvaccinated and identified as close contacts to remain in school as opposed to quarantining at home. So we will go through some of that. That would require obviously parent consent if we were testing students in the classroom. So we did want to get just a feel from parents on whether or not they would support that protocol. And you can see from the pie chart that just over 56% said they were in favor of it. I do want to point out that a healthy portion of those that said no, the reasoning for the no was because they felt the test to stay protocol should apply to all individuals, just not those that are unvaccinated. So if you're identified as a close contact, the sentiment would be that we would test you regardless of your vaccination status. Lisa, I'm going to let you talk a little bit about our Pembroke Health data. I did share here what the weekly data has looked like in Pembroke since school got out in June. As well as our most up-to-date vaccination rates for the different age categories in town. Those are updated every Thursday on the weekly municipal vaccination report, so these are effective as of August 12th.
Thank you. Actually, I just pulled that up, so I'm very grateful you have a slide that indicates that. So the categories that are going to be most impactful for the school committee are going to be the categories, obviously, of 12 to 15 years and 16 to 19 years. And if you notice that those numbers are a little bit lower in the 12 to 15 year category with only approximately 50%, the 16 to 19 at 75%. But the one thing I did ask the state about this data, keep in mind this is fully vaccinated. There are some parents I've spoken to that are in the process of getting their child vaccinated. And for those, obviously, for the younger group, that is the Pfizer. It's the only one that's approved, so it's a 2-shot process. They have to be 3 weeks apart so that there's going to be some fluctuation to that data. Then moving along, that Pembroke trends above most of the state categories, especially in the seniors, which of course are the most susceptible to COVID as far as a fatality or a serious medical issue. They're not the only ones, but they're the most susceptible. So the conversation that's occurring here in Pembroke is occurring all across southeastern Massachusetts. This past Thursday, I was on a joint call that included about half of the health agents from Plymouth County. Most of those schools at this time that we're willing to share where they were at are moving forward with the DESE guidance. Cohasset would be the exception, but I'm sorry, is Cohasset even Plymouth County? I'm not positive. But anyway, they did not, they went in a different direction.
Lisa, I'm just going to switch to the next slide while you're
Sure.
talking because I did include some of the surrounding district data.
Thank you. Some of the other school districts will be meeting after us. Again, this was not concrete data. This was what health departments knew at that time from the school department. Obviously, these things are in flux and could change, but the message at that time was that most were going to go with the DESE guidance. The other thing to be interesting to note, cases in Pembroke specifically. So I work with Nancy Funder. She's our public health nurse, but we also have the luxury of sharing her with the town of Hanover. So she gets to look at a larger cross section than the average public nurse. We've had 50 cases since the 1st of July, 7/1. 15 are children, but 6 of them are not even school-age children, meaning they're very young children. Only 2 were recent enough to still be in quarantine. They should be finishing their quarantine in a couple of days. No serious ill effects to those affected. Now, of those 6 children, I know I spoke to at least 3 parents of those cases because they were in child care facilities here in Pembroke. So working with those child care facilities and the protocols, certain rooms were shut down. Some of you might have even been impacted by that. Some daycares that had to close some classrooms. There was no contagion, meaning that child was there during daycare, made what would have been considered a contact, especially with that age group. They had to close down the room, quarantine the other kids, but no other kids came up positive in any of those 3 instances. Furthermore, we had 2 staff at 2 different daycare facilities that tested positive within their period of infection that were actually working. Again, this caused the shutdown of specific rooms, moving certain kids, quarantining certain kids, and again, no additional positives came out of that. Within our own recreation program here in town, we had 2 staff positives, no kid positives. Only one of the staff members was there during their contagion period. Again, no additional additional positives came out of that case. The other one was on vacation, so it was a 0 impact to rec, but I don't want to say it didn't happen, it occurred. Then moving on to...
just to clarify,
Sure.
in our summer programs here in our schools, whether it was our extended school year program, our traditional summer school, the literacy camp that we ran, or the Y program that was run out of Hoppemuck, there were no student cases or staff cases associated with those programs.
Correct. I was just going to hit the high ones and then hit the low notes. So those are the cases that we know about, that we tracked, that we paid attention to. So now circling around to everything that the superintendent said is correct. None of our school-affiliated programs had any positives that were reported. None of those addresses came up in Maven or any address associated with Pembroke. So that's the good news. And then lastly, congregate care. And the only reason I bring up congregate care is because for those that are familiar with congregate care settings, the level of contact these folks are going to have with one another is not dissimilar to a school. If we all remember back to the beginning of the pandemic, some of the strictest rules were put in place for schools in congregate care settings. And if we remember, congregate care settings had some of the highest instances of transmission across the state. We have a couple of congregate care settings here in Pembroke. One of those facilities has had 2 positives in the last month in staff. None of that has been transmitted to any of the residents. The other facility has not had any. So I just bring that up as a comparable circumstance. So basically what this is highlighting as data for me is, yes, we are having additional cases. Yes, Delta is out there. But it does not seem, when we have exposure situations, that people are becoming sick. An important thing to note about those congregate care settings, though, they have a very high vaccination rate. Because those people technically live in other towns, I don't have the access to their medical data that I would have to a resident of this community, but the facility directors have shared with me, they estimate that they're at 90 to 95% of vaccination rate in both of those congregate care facilities. So moving back along, of the cases that we have had, we have 12 of those recent cases that we know were people that were vaccinated and still tested positive. Some of them we do know are the Delta variant, but there's not always a follow-up to determine exactly what variant anyone had when they test positive. Of all those people that were vaccinated that tested positive, 3 of them didn't even know they were sick, and the others only had mild symptoms. No one even got medical attention for what had occurred to them. Of all the children that the parents were forthcoming in our discussion process, none of those children were severely sick. They were all experiencing mild symptoms. It seems like the number one symptom that everyone keeps going back to is the extreme fatigue, the I just want to nap all day. That is the most on that. That's the state. So across the South Shore again, I expect we're going to see, how many school committees are meeting after us? 5 or 6 of them are after us. We're one of the first.
There are a handful that are meeting after us.
Yeah.
But we're not the first.
So yeah, so circling back around, all of the health agents are going to get back together and discuss what to do from there. Someone asked me, well, at what point do you feel that there is enough concern to take action? And that's a hard one to answer because there's a lot of factors that go into this, so I'll try to wrap it up as tight as I can. Things that concern me are people that are seriously ill, hospitalized, possibly life-threatening, something more than a cold. That's going to concern the heck out of me. That's going to frighten me. When I see a number of cases over and over again, and those case numbers are constantly climbing, that's going to concern me on a high level. The other thing that's going to concern me is when I see community spread, and I think you've all heard me talk about that 100 times. When I'm talking to some of these folks, or Nancy is talking to some of these folks, and we find out that a bunch of people went to the same backyard barbecue or the same church or the same something else, that's going to concern us. Everyone saw the news, Providence Town. Obviously, that was some sort of event that had a significant spread associated with it. So those are the kinds of things that are going to concern us. So the emergency management team in Pembroke, I try not to make any decisions unilaterally. I've not seen the board do that either, and I'm talking about the Board of Health when I say that. But we get together as a team and discuss things that concern us. Ken McCormick, our fire chief, is one of the people that sits in on that. Our police chief, our town manager. And Ken shares the same concerns with me, obviously being a paramedic and the first responders here in town should someone become seriously ill. We have the same set of concerns, and that is how many people are seriously ill and how many people are getting hospitalized, how many people require emergency treatment. Of all the cases we have right now, no one has sought additional medical treatment. None. Zero. So that's really great, because back in the beginning, if anyone remembers, the 2 residents that we lost within the first 3 weeks, the 2.5 weeks of the pandemic, and we lost one significantly after that person had severe complications that were also associated with the COVID-19. We haven't lost any other people.
Can I jump in on that?
Absolutely.
Seriously, because you said seriously, what's the time horizon you're looking at for that? Is that just August?
When I
or
say,
is it
I'm sorry, no,
Yeah.
since July 1st.
since July 1st?
Since
Got it.
July 1st
Okay.
is the time range that we are looking at. Because just looking at August is kind of too, medically speaking, for me anyway, too short of a time shot. Like 2 weeks is not. We know that this virus has a gestation period and everything else, so I wanted to take a larger clip. Having said all that, from May to even through almost the end of July, we had next to nothing happening. So the question would then become, well, what started happening in August, where we did have some high amounts of cases? And again, of the people that were forthcoming when we talked to them, a lot of people said they did travel. Some of them did travel outside of the country. Some of the days where we saw the case counts higher, like there was a case count of 7 one day, 3 of them were in one household and 3 of them were in the other. So the thing I will still message to the public is I cannot stress personal hygiene enough. I cannot stress enough that if someone in your house becomes positive for whatever reason, that the whole house does need to quarantine, and just be prepared that if someone in your house does become sick, it is very likely you will all become sick. And if you're vaccinated, it's great. You might have a bad day. That's what people are telling us, a bad day or 2 at the most. But you still want to be cognizant of that. And now let's go back to what the rules say. So the rules, and a lot of people said the governor repealed a whole bunch of things. The governor didn't repeal everything. Keep in mind that all of the governor's orders all had a date set on them. He had extended at one point some of his orders to a new date. But all of those, what we call sunsetted, they just naturally fell off at their expiration date of the order. So he didn't repeal anything, they just naturally expired. And they were basing all their judgments on case counts. The mask order went into effect in Pembroke, give or take. We are seeing about 50 to 60 cases a week. So again, when I sat down with our emergency management team, 50 is the number we came up with. In a single week period, if we see more than 50 new cases in Pembroke, we've decided we're gonna all get together, pump the brakes and say, what's going on here, try to determine a cause, and probably come out with some recommendations at that point, both for the school committee, the Board of Health. I'm imagining that the town manager might take some action at that point too. The next question is, everyone asks me, is what's that gonna be? I can't speak for elected boards and officials. I can't tell you what that's exactly going to look like, but I would think at that time that would have some sort of indoor public masking to help prevent transmission. But again, that's also going to be based on what these cases are telling us. Again, if a family of 5 goes to Mexico and comes back and they're sick, that kind of tells us something right there, versus, again, people that went to a bunch of backyard barbecues and then there's a bunch of people in town that are sick that were all there. 2 different sets of data. So to say that there's an absolute would be inappropriate, I guess I'll put it, but 50 is the number we're looking at in case counts over the week before we're going to get together and re-examine the current path.
Thank you, Lisa.
You're welcome.
So I'm going to keep going, and then questions specifically so we can get to. So as I said, I do have up here just some of the plans for surrounding school districts. So again, this is a data point that school committee does like to look at, but please know that the recommendations that I make, or that Lisa makes, or that the committee ultimately lands on are representative of what we believe is best for the community of Pembroke, but it is helpful to kind of grasp and look at what other folks are doing. So there are a handful of school committees that do not have a mask policy, If you do not have a current mask policy, then there's no action required by your board in order to follow the DESE and DPH protocols. So like in Abington, there was no mask policy in place, so the board did not need to vote in order to adopt the DESE protocols. It was just a communication that was sent to the community saying this is what return to school would look like. Our committee here is discussing and will be taking a vote on what the fall will look like. So we did learn a lot last year, and though the only recommendation from DESE and DPH is for strongly recommending masks and maintaining 3 feet of space, there is a lot of things that are best practices from our work last year that we will continue to keep in place even though not required to do so. So our students pre-K through 12 will be maintaining at least 3 feet of space in all indoor settings. So that means student desks within the classroom. That means when students are seated at a rug for circle time in our lower elementary grades. That means cafeteria seating. So our students will still continue to eat at student desks in our cafeteria. There will be assigned seating, again, because there is contact tracing that may need to occur within the cafeteria setting in all of our schools. But we will be maintaining greater than 3 feet of space in all settings. I think when you walked by to come in, if you take a peek in the cafeteria, some of the desks are set up there. And working with the administration here at the high school, I think they're about 4.5 feet apart in the cafeteria. So again, greater than 3 feet of spacing. We will continue our hand washing protocols. Generally in the lobby of the high school, there is a portable hand washing station. There's several of those throughout the district. All of our elementary classrooms have operational sinks for students to wash their hands. All of our science labs at the middle school and the high school have an opportunity for students to wash hands, and we will continue to reinforce the hand washing protocol, if you remember from last year, which stated that students should wash their hands before and after eating, as well as frequently throughout the day, in addition to hand sanitizing whenever a hand washing station is not available. Last year, we talked a lot about sanitation and disinfection procedures and protocols here in the district. Last year, the bar was that frequently touched surfaces, so that's doorknobs, door handles, railings, restrooms, were disinfected per the CDC at least 1 time per day. Here in Pembroke, it happened 3 times per day, in addition to at the end of the school day when the building was empty. We will continue that increased sanitation and disinfection on frequently touched surfaces. We have been continually, you can hear the AC here, at the high school, monitoring air quality in all of our buildings. We did a series of air quality testing in the fall of last year. We repeated additional testing in areas in the spring of last year, and we will continue to test the air quality in our buildings as needed. In addition, the #1 thing that has come out of this since March of last year is the emphasis on good airflow and air circulation in classroom settings. So we are fortunate in 4 of our buildings to have windows that open. So windows will continue to be open whenever possible in our buildings. Here at the high school, with a closed circuit air conditioning system, the windows do not open. But you'll remember that last year we installed the UV sanitizing lights within the air ducts. So again, not exposed to the students or staff, but far up in the air ducts in the ceiling, which sanitizes the air as it passes through several times per hour. That will continue into the fall. In addition, we upgraded our maintenance protocols for our HVAC units. So instead of changing filters quarterly with MERV 8 filters, filters are changed monthly with an upgraded MERV 11 or MERV 13 filter. As you can hear, we do run our units even when the school is not in session. That keeps constant air flow through our buildings. We will continue to keep the systems running before and after school, and of course when students and staff are in the building. Anytime there was a repair necessary, it was immediately addressed with our HVAC consultant. So believe it or not, over the course of the day in an elementary school, an exhaust fan may or may not stop working. And we would create a work order, in a typical school year, to have our HVAC consultant come out when we had 3 or 4. This past year, they came out every single time there was an issue with any piece of our HVAC equipment in all 5 of our buildings. So we will continue that process. One of my favorite ones is the attendance policy. So again, we are of course recommending that students and staff stay home at any symptom or onset of illness. So students are not held to the attendance policy that's outlined in our handbook. So there are new repercussions for students that are staying home because they have a sore throat or a fever or a headache. That's more of a game changer at the secondary level. If you are a secondary parent, you know there are generally grading implications associated with our attendance policy, and those are in abeyance, at least for the first semester. I think we will come back and look at it at the second semester if we're in a different place as a community. We were fortunate last year to utilize outdoor spacing at all of our buildings, whether it was our courtyards at some of our elementary schools. There was a couple of locations here at the high school where staff were taking students outside. We will still encourage staff to utilize those spaces. We've created calendars so that folks can reserve the spaces so that we don't have too many folks outside at once. We will continue that. And then I think the community responded well to the COVID-19 dashboard that we had on our website, so we will continue to maintain that over the course of the school year. One of the questions I get a lot about, I'm sure that Lisa does as well, is about the definition of a close contact, how it's determined, and what are the quarantine protocols. So some of this is very similar to the way that the school year ended last June, and some of it is, there are some new pieces to it as well. A close contact across all organizations, whether it's the CDC, the DPH, the American Academy of Pediatrics, or DESE, is defined as an individual that has been within 6 feet of space of a COVID-19 positive case for more than 15 minutes cumulatively in a 24-hour period. That has not changed. What has changed is that asymptomatic vaccinated close contacts do not need to quarantine or test, but must monitor themselves for symptoms for at least 14 days. So at our secondary level, I would anticipate the bulk, as you saw, 75% of that population is vaccinated. There would be few instances of close contacts that needed to quarantine at home due to exposure at school. For asymptomatic unvaccinated close contacts, the quarantine and testing guidance is the same as it was in the spring. So if you are not testing, you must quarantine for 10 days, and you can return to school on day 11 as long as you continue to be asymptomatic. In all instances, you are supposed to monitor yourself for symptoms for at least 14 days. If you are choosing to test, you would need to test on day 5 or later, and with negative test results, you may return on day 8. What's new this year is the rollout of the DESE protocol for testing to stay. So individuals that are asymptomatic and unvaccinated may participate in the test to stay program. I'm going to talk a little bit more about that on the next slide. Symptomatic, vaccinated, and unvaccinated close contacts do need to test or quarantine with the same guidance that I outlined above. Even if you are not a close contact, but you have symptoms. So last year, we had students or staff that were exhibiting symptoms over the course of the school or work day. Students and staff must test in order to come back to school. So that same protocol is in place. If you have symptoms of COVID-19, our nurses and our medical health professionals here are requiring that you have a negative test before you return, regardless of vaccination status. So what is test to stay? So unvaccinated individuals that are close contacts may test to stay. And the program, I really boil it down to just the nuts and bolts here. I will attach the link to the presentation of the intricacies of the program as outlined by DPH and DESE. But what this means is if you are a student or a staff member in our classrooms that are unvaccinated and identified as a close contact, you do not need to leave school in quarantine. You have the ability, with consent of course, to be tested in school for 5 days with a BioNext-Now rapid antigen test. And for those of you that are not familiar with that test is a lower anterior nasal swab. So I know probably everybody in this room has been tested at some point in the past year and a half for COVID, and there's a varying level of experience, whether it's a mouth swab, a nose swab. There's one where I think they take some of your brain matter. This is a lower nasal swab, so it's a small Q-tip that goes just in the lower part of the nasal cavity, and would be administered by our school nurses. The thought process behind that is that when you come to school in the morning, so of course you would not be able to take the bus if you were identified as a close contact. So when you arrive at school in the morning, you would be tested in the nurse's office. The BioNext-Now rapid test takes about 10 minutes to get the results. Once we have your negative results, you'd go on and join your class for instruction for the remainder of the day. Doing that every day for 5 days, of course, 5 school days. With 5 school days, you always have a weekend on either side, if not longer, depending upon holidays and breaks. That would have students monitored and quarantining for the 7 recommended days as outlined above. So with the test to stay protocol, you're allowed to stay in school with daily testing and not miss instruction. As families and students and staff, you have the option to not do that. You do not have to consent to testing. If you do not want to participate in the test to stay protocol, you would have to quarantine and test with the guidance that I explained previously. Lisa, I don't know if there's anything I missed on test to stay.
No, that's all of test to stay, but keep in mind if you choose not to, which is totally your right and privilege, you will be out for the full quarantine period. You cannot do the, test on day 5 and come back on day 7. Day 11 is the first day you would be eligible under our current protocols. And this is true for adults going back to work, so a lot of people get confused on that. So you can test on day 5, and your quarantine on day 7, which means day 8 you would be officially out of quarantine, or you may quarantine for the full 10 days and return to work or school on day 11. That is for unvaccinated individuals. So, but it's the same adults and kids, but she was just covering the how the testing would affect children in school.
Switch gears a little bit. Lisa talked kind of loosely about some of the metrics that the emergency management group would be looking at when making a decision for the town. So I wanted to share with you kind of in coordination with Lisa and our school nurses how I'm thinking about the metric. And so I know that last year there was a lot of pressure both from families and from staff about what is the number? What is the number that makes us remote? What is the number that makes us 100% in person? And I think at the time we just didn't have enough concrete data to say that there is a number, right? It was the demographic, it was the instances of new cases, it was all of that, the stuff that Lisa talked about. I think when we're thinking about a metric for this year, my recommendation, and again, it's my recommendation, is that for schools with less than 600 students, so that's 4 of our buildings, that's North Pembroke, Hobbamock, Bryanttville, and the middle school, that we would institute a universal mask mandate for a period of 10 days for all students and staff, regardless of vaccination status, if we had a number of active cases greater than 10. For buildings larger than that, again, the high school is our only building larger than that, that case number would be greater than 15. I will say, I know that Lisa talked a little bit about the town numbers and when was the last time we had an average of 50 cases in the town. There was only 2 instances over the entire school year last year where either of these protocols would have come into place. One time at the middle school and one time at the high school. So I am comfortable with the metric, but that metric would be taken in coordination with the local health data as Lisa talked about through Pembroke Emergency Management, and again, the committee would have a discussion at that time. Questions about individual classrooms. So our classroom size at the elementary level is generally hovers around about 20 students. So in a particular classroom, if more than 5 students were active cases, I would make the recommendation that that classroom be 100% remote. So that would mean that the students would stay home and receive instruction over a remote platform from their teacher. Understanding that there are still obviously implications of these protocols and metrics that need to be bargained with our teachers union. The metric that I'm thinking about at this time is more than 5 active cases in any one elementary classroom. That's it. I'm not going to go through the appendix. There's a whole bunch of the rest of the survey data and some of the DESE protocols.
Great. Just a couple things again, because I think a few people came in after we started. If you're interested in speaking, please just sign in. We're going to grab the sheet in a couple minutes, and then we'll call people up to speak. That's the first thing. Second thing is for the folks watching at home, I have no idea what camera is on, scinfo@pembrokek12.org. I know we weren't on channel 14 right away, so I think we're up there now. If you have a question, comment that you want, please get it in before we finish the public comment, and then we'll make sure we read it in. So let's start with committee questions. I'm going to try to go through in a weird order, but let's start. I'm going to go Lance. Why don't we start with you, then we'll go Susie, David, Sue, and then I'll finish up at the end. Is that fair?
Thank you both for your presentation. Obviously, information continues to grow, and I think that's important as we make important decisions in this process. Aaron, just for clarity, so 10, that's per school. So
Right,
not
so if
10,
there were
not
10
in a
cases,
cumulative
no, if there were 10
all.
cases at Hobbamock Elementary School, I would be making the recommendation for universal masking at Hobbamock Elementary School, so it would be school specific.
And then 5 per classroom?
5 for an individual classroom, right, which I think gives us the opportunity, and though we did not have instances of school-based transmission and spread last year, a lot of what we saw was outside of school activities, parties, sleepovers, sports, I think 5 in a classroom is a pretty clear designation that there is some sort of in-school transmission. Lisa, I'm not sure if you'd agree with that.
I say, Lisa, which
Again, I'm going to highlight what other towns are doing as well. That's exactly what concerns my counterparts in other communities. For example, we did have a couple of cases in one elementary classroom last year. However, both of those individuals, we were fairly confident where we traced back that transmission to, and it was not an in-classroom transmission. But I share the superintendent's concern. When you see 5 or more in a classroom, you need to start sitting up and paying attention then. That tells me there might be something going on in the classroom. But I believe you mentioned this, Erin, you're also going to have seating charts again this year.
Yeah.
And what that does is that also allows us, now again, kids move around in a classroom, but it lets us know where the children spent the majority of their time. So obviously, if we see a cluster of desks all right together, both the nurse and myself are going to say, well, wait a minute, now we got to take a closer look at this, versus, children on opposite ends of the room. Then we're more likely to speak to the parents and inquire about activities that their children might have been involved in, both in and outside of school, or if they have a particular friend. Certainly if someone tells me that their child is best friends with someone else that happens to sit on the other side of the classroom, but they're both sick, that's going to give us information that we can use to help figure out what might be going on.
Great. I had one other thought. I think it's important, and I appreciate the work that you guys have done. Obviously, I think masking is kind of the key topic here today, but the other steps that are being taken place to help make sure that things are mitigated, that we're doing the best we can as a district to do that. And I think to know that we're continuing with all the steps that we learned from last year, the cleaning processes, the controlled seating, understanding best how to be able to step in when we see a challenge. I think we set ourselves up well. So I thank you for that, and I am all set. Thank you.
Good, thanks, Lance. Susie.
Few questions. Sorry, I'm back. You talked about 10 days that they'd have to mask, 10 school days, recognizing we're trying to get that 14-day period over the weekends. Just want to make sure, and if there's a holiday, then but it's 10 school days, just so people understand. I just want to get that. If with the attendance policy, with people voluntarily choosing to stay home because they are showing some sort of a symptom, at any time during that, if those symptoms last for 2 or 3 days, is there an opportunity for any type of synchronous or asynchronous learning? Our favorite 2 words.
Sure. For students that are quarantining, and that is one of the questions that is in the school committee mailbox for tonight, is what happens if we're quarantining? What type of instruction does my student get? For folks that are quarantining because they're symptomatic, it would be a work packet Google Classroom with a check-in from school personnel. I can't say specifically today that it'll be your student's science teacher or Mrs. McCann, your kindergarten teacher, but there will be a check-in with a North Pembroke staff member if you're a North Pembroke student, with a high school staff member if you're a high school student. For folks that are asymptomatic and choosing to quarantine, again, they do have the option to do the test and stay protocol and not miss instruction, but if they choose not to test and would like to quarantine, it would be very similar. I'm not saying that there will be no opportunity for synchronous interaction with your teacher. I think all of us are just as surprised as many in the state that it is August 17th and August 13th is when we received the guidance on what back to school should look like. So we do have conversations that still need to happen with our teachers. Of course, our teachers came to the table at every instance last year as a collaborative working partner in this work and wanting to do what's best for kids. So I think just not having had the opportunity to have that conversation yet, but I do believe our teachers will continue to support our students that are quarantining for whatever reason.
Thank you for that. This question more for Lisa. As we look at other communities, I'm a big fan of the bell curve. But as far as this Delta variant, which is what folks are talking to me about, we always see kind of the trickle, slow start, then we hit the curve, and then the trickle out as we've had different phases. Is there any indication of where we are in the curve based on what's happened in other towns?
No, because when someone is tested, they're not necessarily tested to determine what variant they have. That's going to depend on the doctor who's doing the test and how far they take it. If someone gets a rapid test, we're going to have no idea, what variant they have. It depends on how far down the road someone wants to pursue their particular case. So no, the short answer is we don't know where your community stands. As far as Pembroke, I do know that when someone is vaccinated and they actually test positive, the medical community at large at this point feels it's more likely to be the Delta variant than other things. And based on the fact that we did have the 8 cases, I'm going to say the Delta variant is absolutely here in Pembroke. Where are we in that curve? I wish I could predict. If I had those skills, I wouldn't be a health agent. I'd be in the stock market and I'd have a Lamborghini. But I think what's interesting for Pembroke, or what holds Pembroke out as a little bit special or in a good position, is the fact that so much of Pembroke is vaccinated. And I would say this, I understand people's feelings about vaccination. I would encourage you to get vaccinated. I have been vaccinated. I don't have a third arm that I'm aware of at this time. And it was relatively a painless process, so I would encourage that. I understand that that's a very personal thing for people to decide, but I've spoken to many doctors, including some pediatricians. They're encouraging the vaccine. We know a lot of kids have been vaccinated without any adverse effects. I totally respect the statement that we don't know what will happen down the line, but it was actually my own doctor that made the most impactful statement to me about the pandemic and about down the line. She does have young children. She has one child that is not eligible, and her other 2 are eligible and have been vaccinated. And I said to her as a doctor, I said, well, you've seen all the bizarre things in medical cases and side effects and possible things. I said, what made the decision for you so easy? She goes, it's really simple. She goes, yes, there are very small statistics about the potential of side effects down the road from vaccines. She goes, that's a fact, we know it. She says, but what scares me a lot more is what's going to happen down the road from the virus. She goes, shingles, polio, all those viruses that came back later in life to do significant damage to people or cause them pain or cause them lasting effects. She goes, we have no idea what that's going to do. And she said that frightened me a lot more for the safety and health of my children than the possible vaccine side effect. And I was like, wow, I've seen a lot of news broadcasts, I've seen a lot of CDC, but as a mom that's also a doctor, that was one of the most impactful statements I had heard about it. So I just would remind people that those that are vaccinated are not having a rough time, even with this quote-unquote variant. So,
Thank you. I promise I'm getting near the end. But I'm just kind of going off a lot of what the public has asked me to ask about, because there's a lot of concern for the unvaccinated levels, which takes me to, can you remind me of the hand washing protocols for the ages that are below the vaccination threshold?
Right. So our hand washing hygiene and protocols that were reinforced at the classroom level as well as through our school nurses was for students to wash their hands before and after eating. So that was for snack time and for lunch. So that gives them 4 hand washing breaks throughout the day, or 4 hand washing opportunities throughout the day, in addition to any time, of course, that they're using the restroom. We've reinforced hand washing protocols for bathroom breaks. But having the sink in the classroom, as well as each of our classrooms at the elementary level has a hand sanitizer pump, so just reinforcing usage of those good practices.
Thank you for kind of going through that in more detail. Last question, then you're done with me. But we always had our yellows and our reds and our green statuses, and there's like a different way they're doing. What are we right now?
So Plymouth County, so instead of doing town by town, I don't know, no one has answered me from the state level or anywhere else why we suddenly switched. But if everyone's familiar with, if you go onto the state website now, we've suddenly switched to a county-wide program. That's coming out from CDC. I haven't seen really an identifier from the state. They put Plymouth County at high transmission, but the one thing I want people to keep in mind is that's county-wide. That includes some cities, that includes some areas that have much higher case counts than we do. I understand, I say understand, I am frustrated just as everyone is with the state, because I hate to say it, the state kind of trained us. They took over from the beginning and they told us what we were going to do and how we were going to do it. And we got very accustomed to that. I didn't like it, but I was accustomed to it. And it just feels like this year, from a health agent perspective, and again, we had this meeting and we asked this question directly to our DPH liaison, and we said point blank, is there a mask recommendation coming? And she had to go back to her superiors and everything else and came back with, no, there's nothing expected out in, there's nothing in the pipeline coming from the state. Which is fine had the state left it that way from the beginning. The frustration for most health departments, or at least expressed on this Zoom call, was the fact that it was do this, do this, do this, do this. School starting in 2 weeks, do what you want. And it was like, it created a shock for us. I did have some discussions with some towns, and I do think that there is what I hope is a small theory behind this. Back to school in Pembroke looks very different than back to school in Braintree, back to school in Boston, back to school in Springfield, back to school in Somerville. And for those hotspot communities, and I know that one of the agents that was on the call, people are probably familiar with the town with us that was considered a high-risk town or a disproportionately affected town for so long as Randolph. And Randolph may do something differently, and they're not actually in Plymouth County, but they're part of our emergency management grouping. So coming back to Pembroke, what does that mean? Well, Pembroke's position and community-wide vaccination rate is a lot higher than some areas, and our transmission rate is a lot lower than some areas, but we're still in a high-risk county because they're now doing it by county. I think that answers your question.
That helps me, thank you. And I'm all done.
Good. Give you another shot.
For those of you new, this is what I do. So thank you for putting up with me for that.
Yeah, first and foremost, ladies and gentlemen, thank you for coming. And I really do appreciate you coming. For the people that did the presentations, if you've seen the hours that have gone into this, you know, the joke was when you join the school committee, it's a couple hours, you know, a couple times a month. When I tell you I've got a full-time job like most of you, it's probably 10, 15 hours a week minimum. The work these ladies to my right have put in is second to none. The young lady to my left, second to none. I'd be remiss if I didn't say this. We get the emails in the box, we get the letters, we get the phone calls, we get the whole thing. The tone of some of them, I hate to say, was so uncivil. I felt like I was the enemy. And I said, I have 2 kids in the system. One's on an IEP, one's in a 504. My daughter is a frequent flyer at Children's Hospital. I'm on this committee because I care. These people are on this committee because they have children and they care. To have people, in my opinion, threaten to sue me and call us idiots and morons, I just don't think it's right. And I'd be remiss if I didn't say it. And I'm not directing this to anyone in the audience. I don't necessarily know any of you by sight or whatever. I'm not wearing my glasses. I'm kind of ashamed of that. So you're all kind of spots out there at this point, but I can read close up. So again, I just want to point out we're on the same team. We're trying to do what's best for Pembroke. I can't make everybody happy. There is not a 100% solution. Someone is going to be, again, I get you being angry with me. I get you being angry with the committee. But literally, some of the personal attacks, I was shocked. And again, I have kids too. My kids read these things. I don't think you want people saying things about you that people were saying technically about us. On that, I'll get off my soapbox for a thing. Couple of quick questions I have. Erin, the bus would go back to the same way, assigned seats?
So
and,
no, the bus, as according to the latest release of guidance, which came out last Friday, there's no close contact designation on the bus because students are masked regardless of spacing as long as the windows are open. So our bus provider for student has also been a great partner in this work. And our bus drivers are amazing here in Pembroke. Many of them live in town and are parents in our community. So as long as the bus windows are open, students have to be masked per the federal mandate on the transportation. There would be no close contacts on the bus. I just want to remind families that windows being open does not necessarily mean wide open. So we did get a lot of parent feedback that the windows on bus 57 are closed. The windows only have to be open 4 inches in order for the proper air circulation and air transfer to happen. So there would be no assigned seating necessary on buses.
Thank you, I appreciate that. The test to stay protocol, that's gonna have a cost attached to it. Is that a CARES fund thing, or is that?
So the tests are free. We are able to get the Buy Next Now rapid antigen tests for free from the state. It is part of their kind of pool testing program that we talked about pretty extensively last spring. The tests are free to us. In the low prevalence situation, it would be manageable for our current staff to manage the testing of any necessary students or staff. If we got to some point where we needed to bring on additional staff because there was 40 students in a building that needed to test each day, we do have some flexibility with our current staff to add additional hours, but any cost associated with that would be CARES appropriate for reimbursement, as well as the CIC, which is the organization that coordinates all of the testing at the state level, does have resources that they're willing to deploy to school districts as necessary.
Okay, I just want to make do clarification. When we say it's free for the year, indefinitely, first, one of the programs, they said it was, we'll test everybody, and then 3 weeks later, we would have to absorb the cost.
Right, and that pool testing
So-
that was free for 3 weeks and then they wanted you to absorb the cost is still free at the state level, just like school lunch. School lunch was supposed to be free through X period, then it was through June of last year, and now it's
Okay.
through June of 2024. So there's obviously funding available at the state level for many of these programs, but I think the need for the test to stay or even the pool testing will start to fall off. But at this point, there is no onus on the school district for the cost associated with that.
Okay, and then, in my best imitation of Susie, my last question, directed towards Lisa. Have we seen anything, senior center, rec department, summer sports? I mean, is anything jumping out at us?
I
or is
hate that.
Yeah,
No,
sorry.
that's the problem. No, it's fine. It's what everyone asks. So, like, is there a hot spot? And it was so easy in the beginning, and I hate to pick on sports because they did such an amazing job, but it was easy to pick out hockey. Hockey obviously had an issue because of the close contact, because of being indoors, because of the locker room atmosphere, and of course hockey solved all that problems by instituting protocols, and of course we all know that once hockey as a sport did that, hockey could continue safely. So you wish it was always that easy where you can really isolate it to a singular event or a singular instance or a singular team or a singular sleepover. In this case, we have found no commonality. The only commonality we've had is some of the families that have had some issues traveled, but they didn't travel together or anything. They traveled in different places.
Thank you very much. Thank you, ladies and gentlemen.
Sue?
So first of all, thank you so much. I appreciate all of the work that everyone's done to put all of this together. I mean, it's an amazing amount of information, and it's very helpful in trying to sort through all this. You know, I have people on both sides of this issue, good friends, so sort of weighed in on both sides. So it's, it's kind of scary that people are so scared of it. And I feel like what you did was just you put all of this information into bite-sized pieces for people to understand, because we do have a plan in place for all of the students, which is great. If there's, at every stage we have a plan, hand washing and, test up to testing, to quarantine. So it's great. And I really appreciate everything that you've done and put it together. I just have a question about, we have summer programs already in place, and students who've utilized these summer programs, and we've had a successful summer without too many instances. So what kind of protocols are in place for those, for like the Y program and the rec center? Like, I'm just kind of curious, like, they are indoors for some of the time,
Sure.
right?
Yep. So our programs here, so our summer programs, our special education programs, our Title I literacy, our summer school, I think we housed Camp Invention here for a period of time. All of our programs for the summer were mask optional per the Cdc Guidance that came out late June of last year. There were students and staff that still chose to wear a mask. And again, any decision tonight about masking or not requiring masking does not prohibit an individual who wants to wear a mask to wear a mask. You have that right as a family, as a parent, and as a student. So we did have some students in those programs that chose to wear masks as well as staff. It was not the norm, but I think what we've talked a lot about is how amazed we have been on how our students have reacted to everything that has come at them. I think we talked in another setting about just how great our kids were about even wearing masks last year, and for our students that on the front end you would think would struggle mightily with that requirement, we're really owning it. I know as a committee, many of you have talked to me individually about the concerns about if we don't have a universal masking mandate, how are we protecting the students that choose to mask from a bullying type situation? And so our school administrators and our teachers are very cognizant of the fact that some students with absent a mask mandate will still continue to mask. I know that Donna McGarrigle, principal of the middle school, and I talked earlier this week about using 21st century skills as an opportunity to talk to students about inclusivity and making sure that all kids feel supported in the choice that they're choosing to make. So that is definitely on everybody's radar as well, but there was really no protocols that were required for any of our summer programming. So I don't know the rec center in particular, I'm not sure, but I know for youth sports there hasn't been anything all summer that needed to be in place.
The rec center did have indoor masking, but that's because the distance protocols cannot be maintained in the rec program. The number of children per room and the proximity in which they sit, they would not be able to maintain distancing, so they made the decision at the beginning of the summer that indoors would be masked and outdoors was not. But again, that's because they couldn't comply with the minimum spacing in that situation.
Yeah, I think I'm good.
Awesome, thank you. Okay, I get a few questions, then we'll go to a few folks who want to speak. I just want to make sure I understand this, because I heard there were the daycare cases and the rec center cases were with adults, not children.
Yeah.
With the-
Some of the daycares did have.
Some of the daycare did, okay, because you
have
said they
young
had
children.
you said they had
Rec
to
did not have any children. Some of the two of the daycares did have children, but
Two
there was no
daycares did.
transmission within the programs.
No transmissions within, but students in the daycare got it from external sources. and
External
brought it in,
sources.
but there was no spread when they got in.
Correct.
And there's no masking requirement in the daycare.
That was going to be my next question, thank you. Okay.
Those
And-
children are, the vast majority of those children are under the age to require
Yep.
anyway.
And I just want to make sure, we did not have any through any of our summer
Yep.
programs. Okay, just want to make sure I got that. That's it later. Protocol to travel, because the first week of school, we have Labor Day weekend, which could be people going away, yeah. So what is the protocol for families that go away in any scenario?
So again, I'm going to go back to the governor's orders, which have sunsetted, which used to say that if you were going to travel outside of Massachusetts, when you came back, you had to quarantine for 2 weeks. That requirement has sunsetted. I'm going to take a more broad approach and just say, use good common sense. We all know that that's passé, but it shouldn't be. If you're going to travel, try to minimize your contact with other people. If you're going to come back from travel, if you don't feel well, don't send your child to school. Don't you go out and potentially go around if you know you've been somewhere that potentially has some hot spots. You know, I don't want to pick on anyone, and I have no problem with anyone going down to Florida, but if you come back from Florida and you're not feeling great, do everyone a favor and stay home a day or two, maybe get a test and see what's going on. The tests are now much more readily available than they ever were before, and they're lower cost, and the vast majority of insurance out there is still covering them. So that would be my advice, but as far as a rule, no. But on the same token, if, you know, like the Zoom classrooms and everything else, obviously if you have young kids and you are going to go somewhere and pretend like you didn't, your kids are going to time you out anyway, so take that off the table. Just behave as responsibly as you can. You know, we made the joke in the beginning, we're all in this together. And I'll say this, and I've been on both sides of people being upset with me and feeling that they didn't necessarily like the path I was taking, but to piggyback off Mr. Boyle for a second, keep in mind everyone's risk comfort level with this disease is different. We have people over here and we have people over here. And when I am talking to people, they of course are always saying things like to me, my family, my children, and everything else. And I have said back to many of them, if it was just your family and your children, my job would be very easy because I could just do what you wanted to do, right? Because I'm only concerned about you. But unfortunately, in my position, I have to think about 20,000 people. And I have to try to figure out what's best for 20,000 people. And then, of course, people have made the statements such as like, well, you know masks make everyone safer. Well, yeah, that's true. But safe to what extent? And I'll say this, when does it end? You know, when is a good time for quote-unquote government to step in and tell people what to do? And when is a good time for government not to do that? And so when I'm asked that question, I go back to the data. And I go back to the experts, and I go back to, you know, where is that line? And so the best thing I can say is talk to your child's pediatrician, figure out what's right for you and your child. And if I can ask anyone at home one favor, is be that awesome parent that sits down and talks to your child, whether or not you want them to mask or not, to be kind to every one of their classmates, whether or not they or their classmates are masked. You know why? Because you don't know that other child's medical history. You don't know who's living with that child. Is that child living with a grandparent? Is that child living with the recipient of another organ? Is that child someone who's been in and out of, you know, children's, you know, hospital? And I applaud it. There's one thing I'll never forget. There was a little boy in Walmart, and I hope he's one of your kids. And he came up and he goes, I'm Captain America, and he has this mask on, and he's got, you can see he has an ear-to-ear grin. You ever notice kids, even when they have a mask, if they've got a big enough grin, you can still see their cheeks and everything else? And he was happy to be wearing it. His family wasn't wearing a mask, but obviously he liked it. And I say 2 thumbs up. I don't know what his situation is. I don't know if he just like Captain America. And he's like, this mask thing's not bad, and I'm going to wear my Captain America mask. But please talk to your kids. Especially at the high school level, especially levels down from there. We don't know what anyone's situation is, and I want you to encourage your kids to do what makes them feel good and safe. Encourage your kids their own personal hygiene. Nothing will protect your child like what you teach them every day to have good hygiene, not pass around food and juice boxes right now. Now's not the time for that. Now's the time to take care of ourselves and stay clean and healthy. And nothing is going to replace you as a parent protecting your child. Nothing I can do will protect your child like you will protect your child. And it's really that simple.
Thank you, Lisa. I have a couple other questions. I'll try to be quick. Well, first a comment on the quarantine protocols and this, the test to stay. That's going to happen, right? Because no matter what happens tonight, we're going to have to implement that or some variant of it.
You guys would have to adopt it as a school committee.
Got it. Okay, we have to adopt that. So if we do, I'd just like to see, because that was really confusing to me, and I thought I knew it coming in. Which is going to be my question. I want clarity. I want to clarify. If we do test to return or test to stay, it is if we're students vaccinated, there's no test and they can stay.
Right, if you're a vaccinated individual, there's no testing or quarantine requirements.
If they're not vaxxed, they're out for a minimum of 7 days without symptoms.
Correct.
Okay, I just want to make sure that was. The question I have is the rapid test. I was taught early on not to believe the rapid test.
Right, so that's why they're going to be doing the rapid test multiple times, and we all know that. The Binax is just another form of the rapid test. Why do we hate the rapid test? False positives. But here's why the rapid test has a place. Does it have false negatives? I know of only 2 false negatives in all of our cases on a rapid test. We do have false positives, but the beauty of the Binax and the test-in is, since false positives are more likely the outcome than a false negative, is we know we will screen out that child that is sick from going back to school. Now let's pretend I opt in, I get the Binax test, oh no, my kid tested positive. You still have the right and the ability to go back to your child's pediatrician or somewhere else, walk-in clinics have them now, and get the PCR test. And the PCR test still trumps.
And that would be our recommendation, and that is the
correct,
recommendation of our school nurses,
yeah.
is that if you receive a Binax now positive test, that you should always follow up with a PCR test.
Yeah. What happens in the 5 days? Let's say it's negative, negative, positive, negative, negative.
So the first positive that the child would be excluded from school, and I don't think I need to tell any parent here, but let's state the obvious. If you get any kind of positive result on your child, of course you should be reaching out to your child's pediatrician for further advice, further testing, what you should do on behalf of your child.
So if you go negative, negative, positive,
you're out.
Off the rapid, you're out, but if you get a negative off of a PCR,
yep.
It trumps the rapid.
It trumps the rapid.
Yes. Yep.
So okay.
PCR is the gold standard.
Just want to make sure, because I know that's going to be confusing for parents as we go through this. I do have, I guess, actually, I'm sorry, 2 ones real quick. So under 12 vaccines and FDA approval, which is one of the reasons why we're low on the 12 to 18, 12 to 16, 12 to 15, sorry.
Yep.
What's the state DBH saying about a potential vaccine for under 12 timing? And and nothing about FDA approval on the others.
Nothing. The 12 to 15 is the Pfizer. They are eligible. Under 12,
they're
there's
eligible, but is it FDA approved?
No, none of it is. None of it has full approval yet.
Right.
It has
Which is
emergency
what-
use approval.
When do they have a timeline?
They have not said.
No, got it. Thank you. And actually, my last question I have, and then we can turn over to folks who want to speak. I saw what you were saying on the 10 and 15, 10 at the elementaries, 15 at middle and high school.
Just at the high school. The middle
The
school
high
would
school.
be under 16.
Okay. So the question I have is, what gets you out? So it's 10 under your recommendation, 10 puts you into masks. When do you come out? Is it 10 over the rolling period? Is it 10? You reevaluate after 10 days out?
So my recommendation is we'd be looking at the health data after the 10 days to see a decrease in cases. Over the course of the 10 days, Lisa and her folks have had a chance to trace the cases, so we know the origin of them. On the onset, we don't know if it's school-based, we don't know if it's travel, so it gives them time to trace. And so then we have the factors that have been important to us all along: the demographic, the instance, the household information. So
I understand what you're trying to accomplish with it.
Yep.
What I'm concerned about is
putting something like that in,
Yep.
and then it end up coming into play because of something that it shouldn't come into play for. That's my
Right.
concern there, because I think of one of those two situations you talked about is something that probably shouldn't have triggered it. So, which is going to be my other question, and this is probably something we can take offline, but the open meeting law requires us to do 48 hours notice. Is this going to fall into a 24-hour notice? We can take that offline, because we can figure about that. So, I think that was all I had. With that, I think we had 3 speakers. If I missed somebody, please let me know. Brendan, I think you were first on the list. And if I missed somebody, please just raise your hand and yell, I missed you, and we'll add you on.
How are you doing, guys?
Good, how are you?
Good. First off, I apologize. I am definitely one of those parents that sent an angry email. I apologize about this earlier, but it was, I saw the decision off the cuff, Papa Bear stuff, so I apologize, right? And I don't think I got personal about it, but just in case.
Thank you very much, sir.
So yeah, I apologize for that. But so I'm here to advocate for masks, right? So I'm going to give my little spiel here, and hopefully it has some effect on you guys. A few years ago, my wife and I were informed that another student in his class had a peanut butter allergy. And as part of that, I remember being frustrated. See, my son has autism and ADHD. If you guys are familiar with that, you know that there's a level of repetitiveness and making sure that you have your normal routine, right? Any changes to those routines can cause outbursts. So I remember being frustrated at that time. But at no time was there ever an instance of, screw that, I'm going to send my kid in with a peanut butter sandwich. And the reason we didn't do that as parents is because we care about your kids' health and safety the same way that I care about mine. I remember sitting my son down and explaining to him that a peanut butter sandwich could really hurt one of his classmates. So we'd need to eat something else at school. And we dealt with my son's emotional outbursts and made it through the year with a couple hundred cheese sandwiches. Again, because we respected the health and well-being of your kids as well as mine. While the majority of children spent the last year in the classroom wearing masks, we kept our son at home because we weren't confident in his ability to keep his mask on and keep himself safe and keep those around him safe as well. It was a dark, long year. It was tough. And to be honest with you, it was detrimental to him. I shudder to think about sacrificing that year of his education to throw him back into school in a non-mask situation when statistically he's 5.9 times more likely to get it than any other kid. And the reason behind that is purely that he cannot protect himself. My son bolts, he needs to be touched, he needs to be grabbed, he's gonna be breathed on. These teachers are vaccinated, sure, I'm told there's an 80% vaccination rate, but right now we're told with Delta that doesn't matter. They can still give it to my son. So, I can think about the last year and speak to you guys full-heartedly and say that yes, it was tough, but I'm at peace, my family's at peace knowing that no one got sick, no one was hurt because of any of our inaction. So what I'm up here to do today is to ask you guys to take action. I'm asking you to mandate masks in schools, at the very least for those elementary students who cannot be vaccinated. I thought long and hard about how I could convince you guys. I thought about pulling statistics, CDC stuff, pediatric ICU pictures, whatever I needed to do, but that's not gonna have the same effect. I kept coming back to this idea of these peanut butter sandwiches and how simple it was for us to make a terrible life decision for my son to change up peanut butter sandwiches. It was the end of the world for him. But it was just that easy to protect the other kids. And we're in a scenario now that I'm just asking you to throw a 3-inch piece of paper onto the teachers and students just to protect kids like my son who can't protect themselves, right? 66% of us parents said we can do it, or we want to do it. I can't get 66% of us to agree on anything. This to me is a no-brainer, and I'm asking you guys to consider. I watch Marvel movies with my kids constantly, and there's always a Spider-Man theme to it that they say, with great power comes great responsibility, right? You guys have this power right now. I understand you can lean on Desi and the higher ups and all of that, but you physically hold the power to protect my son and these kids, right? Don't be reactive. Be proactive. Help these kids. Because what you're doing in an optional situation is waiting for something bad to happen. It's not okay with me. So I really hope you reconsider, and I really hope that this has some kind of effect. Thank you guys very much for your time.
Thank you.
Brendan.
Thank you.
Thank you.
Now, is it Adam, is it Turo or Turo? I want to get it right. Here, okay, you come up to the mic just so you can get you. Tiro, okay. I just want to make sure I got it. I have a tough name to pronounce and so.
Thank you very much for having me and allowing me to speak. And again, I'm a parent and a community member. Been here in Pembroke about 4 years with my family, and we could not be happier to be here and a part of this community. And a big reason why is the schools. I have 2 daughters that are school age now. I'm also a special education teacher. I've been in special ed for the last 15 years. So I can relate to this on many levels. I've also been a team chair of special education, so I can relate in that level too to a lot of different sides of this. And I had a lot of thoughts in my head, but having heard all the wonderful points and discussions you guys have all brought up, I really just want to say thank you. I feel like you guys have all been leaders in this, and Pembroke has been a leader and a forward thinker in this since the beginning, and our kids have been back, and our kids have been safe, and it's been proven. And there's noise everywhere, and I feel like we can start moving away from that noise and start creating new basis for moving forward. And I'm just grateful to Superintendent Obi, who's been wonderful and receptive to different thoughts, and I know it's not easy. And I'm sorry, I didn't catch your name.
Quite right, Lisa.
Lisa, thank you. Truly, like, moving away from the narrative of fear and rational fact and thought. And there's no judgment either way, whatever. I'm not someone who, I hear you, I'm not someone who judges anybody for anything. But just moving away from that narrative and being thoughtful and having that evidence that you say about Pembroke, that is really wonderful and positive. And I just thank you for sharing that. And maybe try to get it out there more, you know, and maybe the more people are hearing positive things. There's so much, we can go to our phones and see negative. There's enough of that. Maybe keep it going positive, and I think things can keep going in a good direction. And I just thank you all for your work. And I can tell you, obviously for my parents, I feel like I'm the one maybe that doesn't matter. From my girls, they thank you, and thank you for all your work.
Thank you.
Thank you very much.
Adam.
And the last name I have, and if there's anybody else, please speak up. Tom Beard. I should have known, you looked like you wanted to jump up, so you look good.
I wasn't really going to talk when I got here. When you asked to sign, I figured sign up and introduce myself. My name's Tom Beard, everybody. My family and I just moved here in January. I have 2 little girls, 4 and 6, and they're both in North Pembroke. We're from Hyde Park, and we couldn't be happier with this community. We left there for a reason. I still work there, and I see the way the city is now and the way it's changed over the course of my life. And I got to tell you, you should all be very proud of the community you have here. It's sports, schools, everything. And I especially want to say thank you to all of you. This place is fantastic. I do have to speak on behalf of my children, though, who I feel are being, sadly and unnecessarily, in the school system, forced to wear masks going forward. While I respect everybody's right and decision to put masks on their children, I would just ask that everybody respect my right as a father to not mask my child. I do understand, and I'm sorry for the situations that occur in every family. I really do. And I understand the necessary precautions that everybody needs to take for themselves. But I need to come up here and speak for what's right in my mind. And I feel sorry about the situation going on with your child. I feel sorry for everybody. It's a terrible situation. But our children, and I wish you could go back to some of the statistics, but the majority of the people affected by this disease have the ability to get a vaccine, whether or not it's approved by the FDA or not, fully. The people that are most likely to die or be hospitalized have the opportunity to get a vaccine. If they so choose not to do that, then I'm sorry. It's time to look into personal responsibility, okay? Everybody knows that they have that opportunity, and they choose not to do it. I'm sorry. I don't like to speak about what I've done with my health, but I will tell you, I am vaccinated, and it was a very hard choice for me, okay? My wife is vaccinated, okay? These are personal, private things that
can be left alone to the family, in my opinion. I'm encouraged by your survey. That would never be done in Hyde Park. They're just going to tell you you're going to school, you're wearing a mask, that's it. I'm encouraged by it. While I believe your first question was extremely vague and kind of pushing everybody in the direction to answer that you wanted them to answer, I appreciate it because I don't think it happens everywhere. And I know you care about everybody in this room's opinion, okay? So, going forward, you mentioned something about the state not mandating any regulations. I work for the fire department in Boston, and I kind of understand how the regulations have progressed. I'll tell you this, going back as far as Governor Baker has been spouting off all this stuff, I would say at some point he realized, let the people in each community deal with this as they see fit for their people, okay? And that's why, because the vaccines came out. That's when everybody's like, oh, okay, well, why isn't he making these decisions for us anymore? It's because the vaccine came out. Let people make decisions for themselves, okay? As for that, I would say you put up a bunch of other towns, and I gotta tell you, this is the best one out of all that list, okay? Don't be Duxbury, don't be Marshfield, don't be Hyde Park, don't be Boston, be Pembroke, and make your own decisions. Don't care about what they're doing. You guys have an 80% vaccination rate, which I just saw, and I'm very proud of that. But I will say, be yourselves, don't worry about everybody else, and do what you think is right for your kids, like I'm gonna do for mine. Because they're out there playing soccer, associating with all these other kids, and then the next day they're in here wearing masks. What are we doing? We're suffocating our children. So please, I really do respect everyone's right. Please respect us. All right, thanks so much.
Thank you. Thank you. Did anybody else want to speak? Just come on. Just please state your name because I don't have you on. I don't think I have you on the list.
Yeah, no, I'm not on the list.
Okay.
Allison Glennon. I have 4 children here in the system. We were cohort D last year. I fully support a mask mandate. I have a child very similar, like shockingly similar, where we're currently trying to figure out how he's going to eat, not eating peanut butter. I took my 12-year-old the day he turned 12 to get the vaccine a week ago. He's not going to be fully vaccinated by the time school starts. He'll be close to it. I fully think the unvaccinated, we have to protect them. The only way you guys proved the system last year that we can keep the schools safe and the kids in the classroom. I couldn't send my kids last year because of the situation of our living situation, which was now changed. But we proved it. It worked. The kids were safe. There wasn't transmission in schools. Talking to teachers, talking to other families, we've got to do right by the kids who can't be vaccinated. We have to protect them, and right now that's by wearing masks, social distance. The other part I'm kind of wrapping my head around is, okay, so if a kid has to wear a mask on the bus, doesn't have to wear it in the classroom, how are you going to have like 5, 6-year-olds managing that? Like, I don't think my 6-year-old who just turned 6 can manage keeping a mask clean. Where do they put it? Like, what do you do when they have to have a mask on the bus, going to school, coming home from school? That just doesn't make sense to me. And another question I have is for the testing to stay. We've heard that the kids in families, if you get sick, the whole family gets sick. Well, do you have to test the siblings at different, if you have one in middle school, the high school, if their sibling tests positive at the rapid, I don't know. There's too many, if we just had the kids masked, there wouldn't, based on the buses, they don't have to be considered close contacts. Would they not have to be close contacts if they're in the classroom masked? I don't know. I just feel like it's a no-brainer to protect the kids, we know the science, we know kids need to be in the classroom. I had to homeschool one of my children last year because he could not manage the online. It just was insane, which I think I've spoken to a couple of you about that. But to me, it's just a no-brainer. So please, at minimum, for the kids in elementary school, like my son, we held him back before he even started school, so he'll be probably one of the only 6th graders coming into school almost vaccinated. elementary schools, I don't know, it's just a no-brainer to me that it's such a little thing that the kids were able to handle last year. As far as I know, they didn't have to like take masks on and off at different times. Like, oh, where's my mask getting on the school bus? Is the school bus gonna have masks? Like, I don't know. I feel like if we just have a mask mandate, it solves a lot of these problems that we just don't have to worry about. And please protect our kids. I can't do any more than send my kids with a mask, but please, I have 4. One of them has another children's hospital. We just saw his pulmonologist today. She could not believe it when I told her that DESI wasn't like mandating. Like, she could not believe this is a children's hospital pulmonologist. Could not believe it. The doctors are telling me, so I don't know. Please consider voting for at minimum the K-12. I mean the K-6, because I have a 13-year-old who doesn't show up on your health data because we enrolled her in the Moderna trial. So she's one of that. I drove her to UMass 4 times this year so far because she's in the trial, and they end up having to unblind them because I don't know what the FDA and CDC is doing, but they've not taken up the Moderna 12 to 18 yet. And so many families were like, we need to know if my kid's vaccinated or not, because if they're not, we want them. So my daughter was unblinded. She did receive the vaccine back in February and March at UMass. But, so it's like, I feel like there's those of us who are doing everything we can for science, for the health, for our kids. Now we're leaving it up to 5 people here. And it's scary, and it's like, I don't know. I just feel like it's a no-brainer. And I definitely respect other people's opinions, but it's a mask. It's not, we're not asking them to mandate vaccine. Like, I'm not asking that. Like, it's a mask. It's not a muzzle. It's not anything else. It's a mask. So, thank you.
Thank
I
you.
just want to make sure we get your questions.
Sure.
Right, because you asked about masks in bus to school transition. You asked about something on test to stay.
Yes,
And
like
was
the
there a third question?
siblings. Like,
Okay.
I have 4 kids. I
You got
have 3 at Hobnock and 1 at the middle school. So what happens if my first grader tests positive? Do you then pull my 4th grader, 6th grader, 8th grader? Like, what do you guys do?
Yes.
Right?
Okay.
The short answer is yes. The
Yes,
minute
and
someone
they
in your
need
house
close
is
contacts.
positive, you all become contacts. You all
And
need
they
to
can't
quarantine
test
until you
to-
test.
Can they test to
They
stay?
can.
They
Okay.
can, but they would then be in the
And so-
testing
so-
protocol as
But
contacts.
if they were wearing masks, that
It would still happen.
That's
It would
untrue.
still-
So in the classroom with masks, students are still close contacts.
Correct.
Okay.
That
but
does
not
not
on the
change it.
bus.
So the bus they're not close on, so students are not on the bus in most instances for an extended period of time. Some of our students do ride the bus up to 30 minutes, but the federal mandate states that it's not a close contact on the bus as long as there's airflow with the 4-inch windows open and students are masked. There's no spacing requirement. Last year, I think we went through every iteration of spacing requirement on the buses. It was 6 feet, it was 3 feet, it was no spacing. So now the final ruling is no spacing, masked with windows open, no close contacts created. But over the course of last year, there were periods during the day where students were unmasked. So during mask breaks, at lunch, during snack. As I said earlier, our students were amazing. They kept their masks with them. I saw some of the most creative mask lanyards where kids were wearing them around their necks when they didn't need them. So all of that works. We also have a healthy supply of masks for students and staff. So if a student loses the mask from the time they got off the bus in the morning to the time they need to ride the bus home in the afternoon, we have a mask for them.
Okay.
So.
Yeah, my daughter went to field day and came home with not the mask I sent her with, so she
She's
like,
always
loved
ready,
it.
right?
Thought it was like, where'd you know. So anyway, so I appreciate those answering those questions, but it's just
Years before, it used to be a different lunchbox. Now it's a
yeah,
different mask.
yeah. Thank you.
Thank you. Okay. Anyone else? Sure. Just state your name so we can get it in.
My name's Lauren McMorrow.
Sorry.
I have a 13-year-old in the middle school. I'll start by saying, as an adult and working with the public, when I went back to work, seeing people in masks, I was meeting them for the first time, had no idea what their faces looked like. When masks came down, not what I thought their faces looked like. I felt like I never really got to know anybody. I never got to see expressions. It just didn't feel right to me. My 13-year-old's going to school, meeting new kids at the middle school because all the schools are combining. Didn't get to know anyone's face, couldn't see expressions. Talking to other parents that are in the same age group, these kids are already going through a lot of emotional turmoil at this point, hormones. It's screwing with them psychologically. I know, and I respect anyone that wants to wear a mask. Wear a mask. It makes you comfortable. I understand that. But I think we're not thinking what mentally this is doing to our kids long term. And it makes me really, really sad because I don't think the mental health is being talked about enough. And for this age group specifically, my husband at work gets singled out because he is unvaccinated. They joke, they call him a leper. This age group teases each other. She feels the pressure from her friends. Are you getting vaccinated? Why is this being put on them? And at the end of last year, we got it from one of the teachers in school, was asking children who was vaccinated, having kids who were not vaccinated stand up. What is your reason for not getting vaccinated? Telling them they were going to be responsible if their family and friends died. It just, I want a homeschooler so bad because I'm terrified of what this year is going to bring. And all the safety solutions you're doing, hand washing, hygiene, I love it. It's great. We should have been doing that from the beginning. I'm just, mentally, I'm not prepared to send my daughter to school in a mask or on the bus. If you're not comfortable sending your kid on the bus, drive them. There's just so many other solutions that you said it before. When does it stop? We have to take a time and just say, this is it. I don't know. I just needed to get off my chest. I wasn't planning on speaking, but
You did great.
thank you so much.
Just so you know, though, anything like you talked about, mask, no mask, whatever, that's bullying, at least in my book. That shouldn't happen. So that's
It's
something.
just she currently has one friend who's not speaking to her because she's not getting the vaccine.
That's
I know.
That's not, it's not what we're trying to encourage for behavior, I think.
Oh, I don't think anyone's intentionally doing it.
Oh, I know,
but
I
like,
understand.
it's kind of where we're at in this point.
But just so you know, because you touched on one other point that we're not talking about tonight, and that's social emotional well-being of our students, especially at the middle school. I've been working in touch with a parent all summer, and there's obviously some kids who are suffering across the board, K through 12, pre-K through 12. There has been a lot of discussion at this table and with all the ladies to my right about what can we do, and they are doing things. I would say if it's not on tonight's agenda, we can make sure it's actually planned for one of the future agendas. So it is coming up as we continue through.
No, I plan on coming to these much more often.
But just so you understand, and you can even watch live, we are addressing that so that because we know through interrupted learning, these students are suffering socially and emotionally. Regardless of what we decide tonight, we're going to have impacts that we have to deal with. So,
I understand. We should look at some other rates that are out there besides
absolutely.
COVID.
But thank you. Jim, did you want to go, Jim?
Yeah, I have a couple questions.
Absolutely. Come on.
Jim Quigley. So, with the test to stay, which sounds fantastic. So, the first, as they go through the process, do they have to wear a mask?
They have
Because
to wear a
that seems
mask
to make
as a close
sense. Okay,
contact, yes.
all right. So I didn't that part I didn't catch. Teachers that aren't vaccinated, are they going to be required to wear masks?
So we don't have, my recommendation to the committee wasn't a mask mandate for unvaccinated individuals. If that is the direction that the committee deliberates and goes in, it would be up to them whether or not they'd be requiring masks of staff or just students. We do not collect vaccination records, or have not to this point collected vaccination records of our staff.
Okay.
If we have staff that were identified as close contacts and wanted to participate or opt out of the test to stay protocol, they would have to give us their vaccination record in order to stay. But.
Can you repeat that part? I'm sorry.
Sure. So if we had a staff member that was identified as a close contact, they also would have the option for the test to stay protocol,
Okay.
or they could share with us their vaccination card, similar to our students that are 7 through 12 that are vaccinated as well.
Have there been any discussions with the teachers union just about going forward with the possibility of a vaccine mandate? I know there's been some with the Boston's teachers union and things of that nature. I respect what the gentleman said earlier about how it's, as an adult, we have that choice, but the kids right now don't have that choice, and so.
Right. So
Yeah.
our teachers here in Pembroke are represented by the Massachusetts Teacher Association. I'm sure many of you have
Yeah.
seen the public statement that that president made, Mrs. Najimy, saying that the MTA supports a universal vaccination requirement for staff. We have not had a local conversation with our teachers.
They just came out with that today.
Okay.
That was, actually, it was even this afternoon.
Yeah, and I think the National said it a couple days before, and it just
but
kind of.
they just voted, their board of governors and board of directors voted yesterday, and they released
Okay.
a statement today that they are asking for universal vaccination.
That they support
They support,
vaccination
yeah,
requirements of staff.
Of teachers.
Okay, okay. That was really it. You know, the only thing I'll say is I think you guys are in a tough spot that Desi put you in, where they kind of went right up to the line, and I'll say now it's on you guys to figure it out. You know, I respect the fact that you guys are hard at work at this. I completely appreciate where people are coming from with kids wearing masks and the concerns there. I guess my biggest concern would be my child missing more school time because there were, you know, this virus was passed on. We missed a lot of classroom time over the last 2 years, and I know you say you're data-driven, so you're looking at the health stats, but, you know, that is one stat that I'm a little bit concerned about, and just going forward. All right, thank you.
Thank you.
Thanks, Jim.
Thanks. Anyone else? All good? Oh,
I do want to say something.
Sure.
You know, and I respect
Just-
Brett says nuts.
Say- I'm sorry,
So
what was the last name?
I do, I'm sorry?
What was the- I didn't hear your last name.
That's why I didn't say it at first. Says nuts.
Okay, got it.
No,
Thank
so, and I respect everybody's choice, and this is America, you know, and we should have a choice. And I feel like the masks are doing more damage to our children than it's worth. Number one, I have yet to see any science where these masks work. The only science I've seen is that it's detrimental to children's health. You know, our mouths are very dirty, okay? And we're putting a mask on our face, we're breathing out bacteria and stuff all the time. Now we're trapping it for these children, you know? And so you got the health aspect of it, and then you also have the aspect of being able to see everybody's face and being able to see their expression. Is he happy? Is he sad? Does he like me? Is he mad? Is he angry? Is he happy? You know? I could go on all night long. I'm going to keep it short and sweet. I just wanted to let you guys know that I don't feel as though they are helpful. First and foremost, in order for it to really be effective, okay, does it help? It may help a little bit, okay? But the mask, in order for it to really be effective, what does it need to do? It needs to fit to your face. It does not fit to these kids' faces. It's all open on the side. So when you're breathing, what's happening? It's escaping, okay? You know, the particles are so small, okay? I feel like, you know, where the mask really helps is if somebody is infected with COVID and you're standing in front of me and I'm infected with COVID and I cough. I feel as though it protects you a little bit because it's going to go out the sides, not directly at you, you know? Other than that, I just want to see something. I want to see a study that says this is protecting our children. It is psychologically damaging them. Those are my beliefs, you know? I don't... So, obviously, I'm against a mask mandate, but I respect the choice of people being able to wear a mask. You want to wear a mask, wear a mask. It should be people's choice.
Thank you.
That's it.
So, okay, yeah, he was going to go there next. So, okay, so we have a couple questions that came in through this school committee email or SC info email. If anyone has any real quick, we're going to get to these two and then we're going to move to the committee.
Sure. So there was a question early on about quarantining for students. I think we've covered that. There was a follow-up question for Lisa on whether or not the congregate care and rec department cases that you talked about were masked. I think you hit on that. A question about buses, which we answered. There's one parent or community member that was looking for the specific data on the K to 6 survey responses. I did share that earlier. We did call out parent caregiver feedback. On the right-hand side, you'll see elementary only, as you know, in some instances that is the population that we're talking about that is unable to get vaccinated. And you can see from the chart that 64% of parents were in favor of the strong recommendation for the mask that DESE has put out, but not requiring the mask. And the last question is around pediatrician recommendations. So I'm not going to read it verbatim because it does have some personal information in it, but the question is that this parent was at their pediatrician's office and her pediatrician mentioned that they had sent letters to all South Shore schools recommending masking for all students. She wants to know if you've seen that recommendation. So I can assure you that all communication that comes in through the school committee, for the school committee, is handled through Natalie. We have not received anything from a list of South Shore doctors recommending masking for students. I can tell folks our school physician is Dr. Gina Boutwell. She practices out of South Shore Health. That's located in Norwell. I have talked with Gina, our school nurse, our head nurse, Joanne Erner, has talked to Gina, and Gina is on board with what we're talking about this evening. Okay. Lisa talks to Gina as well as the other public health nurses. So.
Yeah, and I shared with you some thoughts from my own primary care physician. She is also part of South Shore Health and also works out of Norwell. Doesn't work with Gina. She's obviously pediatrician versus family medicine, but.
Okay. Just a couple things. I'll give you a second to refresh that mailbox. Just so the committee is aware, there was an email that came in this afternoon. I didn't see it until about 4, and I thought it was going to get forwarded, but it came from Jessica and Matthew Rushing. Jessica, chairman of the select board, and Matt, you part of the advisory committee, asking for a mask mandate, citing the American Pediatric Association in the CDC recommendations. So just so everybody's aware, that came in this afternoon.
Are they speaking on behalf of both those committees or individually?
It was signed, chairman, and you'll see it. I'll make sure you get it this evening. It was signed chairman of the select board and an advisory committee member. However, the way it was written, I'm inferring that they were referring to they were writing it on behalf of themselves because they referred to they had 3 children in the district and where they were within the district.
Thank you.
Yep. So yeah, nothing from the boards.
Other than that communication, everything that has come into the box has been forwarded to you.
Including, I think, there were 2 this morning and one yesterday afternoon. So that's that. Couple things. First of all, thank you everybody for coming. Thank you everybody who came forward to speak. Thank you everybody who sent emails, filled out the survey. This is important to us. Clearly, we wanted to hear from the community. Glad you all came out. This is what we do on a lot of Tuesdays, and we're always here, and there's usually we're in that corner, and there's plenty of seating, but that's okay. So thank you again for that. What we're going to do, a couple things. So we need to take at least one vote. We potentially could take 2. So let me kind of frame it, and then I'll take it around if we want to go on a roundtable again for discussion. We have to take a vote if you're in favor of masking, what you're going to do is reinstate the policy that we have. Regardless of what the vote is tonight, that policy needs to be modified after reading it. We put dates in there which need to come out because if this ever happens, hopefully, I never thought I'd be talking COVID 18, 19 months later, whatever it is, but we have to make sure that policy survives time in case we ever have to invoke it again. That's if you want masking. If you don't want masking, all we have to do is reiterate that we're following the DESE guidelines. And just so everyone here is aware, and Lisa and Erin, keep me honest because Erin and I have talked about this. The CDC guidelines is a recommendation for masking. It is not a requirement, which is similar to what DESE is. It's a recommendation, not a requirement. If you think of the 3 organizations that can mandate masks in schools, as Erin started at the beginning, it's the Department of Public Health, the Department of Elementary and Secondary Education, in the Pembroke Board of Health. Okay, none of them have come out requiring. So if you're no mask, you want to follow the guideline, just would maintain the DESE guidelines going in. Regardless of that, there could be a second vote if the committee wants to implement the test to stay protocol for anyone who is a close contact but wants to stay in. They didn't miss anything. Is that clear? Does it make sense?
Yes.
Okay, just want to make sure that was all good. That said, anyone have any other comments, questions, thoughts? Anybody want to make an initial motion?
Can I just share one thought, Mr.
You
Chairman?
absolutely can.
no matter what happens here tonight, folks, and I hate to say this, but it could all change tomorrow. We've all been there. Try not to be too excited or disappointed wherever you fall on whatever happens tonight. Keep in mind the statistics and the numbers can always change, and they tend to change. And keep in mind that this does not preempt the Board of Health from putting in a regulation. I've already kind of given you an idea of what number we're looking at for that change, which would affect all municipal buildings, which does, as the superintendent acknowledged earlier, that impacts the schools. So just understand that we live in a fluid situation. Anyone else hate that phrase as much as I do? Yeah. So try living your career that way. So just keep in mind that we are going to follow the data. I shouldn't say that. They're going to do what they're going to do. The Board of Health and our emergency management team is going to continue to follow the data and understand that data changes daily. I've had many conversations with people and said, but you said last week, and I said, this week is we live in a different world this week than we did last week, and I could live in a different world the week after. So what I'm just asking is for a little understanding and a little flexibility from you that as the data changes, the recommendations could change as well. That's all I wanted to share.
Sure. I mean, he just came in. No. I saw you just came in. You know what? Because you just walked in. If you want to speak real quick, you can. We went past that, but just state your name so we get it for the record.
My name's Maureen Jacey. I was watching online, actually, the meeting. I'm sorry, I missed it after Mr. Beard. We ran up here. My daughter is entering freshman school at Pembroke High School, and she asked me if I would bring her here tonight because she wanted to express her opinion as a student in your district. I don't know if Kate, if you feel comfortable, if I might just stand with her because she's a little
Come on up.
to speak to all of you.
We're not scary, I promise.
We don't bite. I promise.
I'm a freshman, and I just wanted to say how I just think it's foolish after being all together all summer that we have to go and put masks on. I just don't feel that it's right. That's all.
Fair enough.
Well, thank you. Good job.
Thank you.
You did very well.
If I might also add, I have another daughter who's entering 8th grade and a son who's at North going into 6th. I will say that I, without calling them out, I think that entering middle school masked and merging with 3 other elementary schools was extremely challenging to meet 2 other elementary school populations with your face covered and to not have the non-verbal social cues available to you to make relationships, such as a smile, or just maybe, I know that maybe you might be able to see some cheeks go up behind a mask, but nothing takes away from looking someone in the eyes and giving them a welcome with a smile. It's not hard to do. It's easy for a child who's very, very socially aware of everything. They all want to be the same. They all want to be alike. In handicapping, I know that there's a pro that masks, people may argue, are protecting children, but I would like to offer you the opinion that masks also could be harming children. As I just gave you the example of a social example, and then I am not a scientist. I'm sure as all of us have done a lot of reading on the benefits of a mask or a thin piece of paper and whether or not it's really effective. Who knows the real answer? None of us do. But I ask you to please, before you make a decision, consider the children and those social harms that we are imposing on them, as well as taking away a parent's right to make the best decision for their child. Thank you for allowing me to speak at this late time.
Thank you.
Thank you.
No worries. Thank you. So, with that, does anybody have any, we can go through the same order we went through before, get comments out, and then we can make a motion. Would that be preference? I'm going by what the group wants. Mitch, you want to start off, anything you want to add besides questions?
I want to express thanks to everyone that got up and spoke today. I appreciate you speaking on behalf. As a parent, I'm the parent of the one with the peanut butter, so I thank you. And I understand all that side. I think when you're sitting in this situation, as a parent, I've had to make my own decisions for my kids, right? And same thing. You worry when they go to school, are they going to be protected? Are they going to be safe? One, know that from what I've seen from our team, they're looking out for those kids, and they're going to do the best they can for those kids. This is a difficult situation. I see the mental health side. I see how it affected my child, and he wasn't a good remote learner, but he did awesome when he came back, right? So I see those things. There's a lot that plays into this factor, and I wish there was an easy button on this one to what masks can do. Choice is always a big part of where I'm at and where my decision is. So I want to make sure that all our families have that choice to make sure that they're in a good place for that. I'm glad that this is continuing to be a fluid situation because we want to make sure we're constantly doing, maybe at this phase, we're doing what we feel is best for our students, but that may change quickly and we want to be able to have that flexibility. So that's important to me as well. There's still a lot to digest here and I appreciate everyone's input in that, so thank you.
Susie, did you have anything you want to add or say?
I just agree with Lance, and it is amazing. We all feel so different, but I have an asthmatic, and we spent the first part of her freshman year at Boston Hospital because there was no bedded children, and she would have died if she hadn't been transferred. So I get it, because we don't know what it was 3.5 years ago, but it sure does walk like a duck and talk like a duck. We just wanted to have a normal year, and I have a peanut allergy, and somebody that's not eligible for the vaccine also in my house. So this is emotional, and one of the few times I probably won't talk a lot because I'm a crier. I don't know what happened, but about 10 years ago I just became a crier. But I am so grateful that you all had the courage to write or to call or to come in and speak. It's hard. I've been there. I talk a lot, but I shake and get nervous. I'm holding my hands together because they're shaking, because this is a big decision and there's a lot to it. But I reiterate what Lance says. This is fluid. And if something shifts, we will shift with it, because boy, have we been shifting. David spoke to the hours. My freshman, who's now a senior, asked me to do this job because a different issue came up and I was on that side of the microphone. And thinking back on that speech, I might be described as maybe a small school committee terrorist, because I was really coming in armed for bear. So, and they did then what they're doing now, listening, not judging, and they let me say my piece. And I am so happy to get to be a part of that now. So we will be fluid. We'll make a decision, but we'll keep putting in the countless hours. I stopped counting my first year at about 1,000 because I have to read everything and ask questions and talk to people to get the hang of it before I come in. I'm on my 4th or 5th notebook, and you don't want to see how many folders I have saved in my file. So there's a lot to this, and I love it, and I love this town, and I love the energy that you all brought here tonight, so thank you. Thank you.
Come on, yeah, get to be more positive this time. Yay. Thank you, everyone. And, not to reiterate my colleagues, this is probably the toughest decision I've ever had, in my political career. This is my second term. Last year I thought it was going to be tough when we were voting, do we go back to school, remote, full, whatever. And I found it interesting. I was thrilled by some of the positivity. Mr. Beard, I believe, was fighting around the other. Tara might be the two of you. But, I love hearing that. No, it was you. You guys were right there. It was Mr. Finlay, I believe. I said that the story hits me. Like I said, I've been a frequent flyer. They said at Children's, and it's not pretty. And it gets a little crazy. I grew up in a situation where my dad was my high school principal. So think of that one, folks. Go to the prom with your mom and dad some night and tell me what a wild night you had. It was pretty cool. And he always used to say, you've got to do what's best for the kids. And he said, it's all about the kids, he says, and the parents will take care of themselves. And I used to try to figure that out when I was a kid going, I don't get that part. But he was always about the kids. So I've got this kind of devil and angel sitting on my shoulders. I will not take this vote lightly by any stretch. This, it's your kids, it's my kids. We care. We all have kids in the system. Mike's just recently graduated. And again, I'm sure some people are going to walk out of this room thrilled and think we're the smartest people they've ever met, and there's going to be some people that walk out of this room that hate us and want to run against us and do everything else, and I get that. But I'm not gonna lie, I'm torn on this one. This is, I wish I had like a day to go home and kind of sleep on it and think about it and do whatever, but I've been doing that for God knows how many weeks now. On that, I'll be quiet.
Sue?
Yeah, so this is my first big decision, and it's a really big decision, so it's a little scary, I have to say. But, you know, I'm a parent. I have 4 children. 3 have already gone through Pembroke Public Schools, but I have to say, peanut allergy, so again, and 2 kids with severe chronic illness that were on 504s all through their school history, who are obviously doing great now, but still, even in college, you know, it's a concern about, you know, being around people who, you know, aren't vaccinated or them possibly getting it. One of my immunocompromised children did end up with COVID, and it was really scary, but it was fine. He wasn't too sick, so, but in any case, you know, I'm a parent, and I have a 13-year-old daughter who is in the middle school, and so this affects her as well, and I want everybody to know, everybody at home as well, that I've read through every email that's come through, and I take every email very seriously, because this isn't just about my daughter, this is about the town of Pembroke and how you feel. And that's obviously what's most important. And I've looked through them and I've read them over some of them a couple of times. And there's a lot of people who are really passionate on both sides of the aisle. So it's a very difficult decision. You know, everything that you've said has really hit home with me, and I just want you to know that I take this very seriously. And, you know, some people are not going to be happy with the decision, but, you know, I feel like we have a really good plan in place. Regardless, we have a really good team who's on top of it on a daily basis. This isn't just like we're going to vote on it once a month. This is like an ongoing daily thing that we're all going to be looking at. So, you know, regardless of which way it goes, just know that we're always going to be looking at it and changing our mind based on the new statistics that come out. So, but that's all I can say.
So, a couple thoughts here. First, one thing we didn't talk about was athletics. The MIA is not coming out with any guidance on masks, so the MIA is not recommending masks or leaving it up to local control. So in that scenario where when Aaron threw up the towns, if we were to play at Cohasset, our athletes would be masked. If we were to play at Cohasset was to play at Pembroke, depending upon where, let me make it easier. Silver Lake and Cohasset, based upon the votes, because I don't want to anticipate a vote. Silver Lake and Cohasset, both teams would be masked. Cohasset at Silver Lake would be unmasked, and it would be up to Cohasset what they want to do. So just so you, because that's one of the other things that comes up, is what's happening with athletics. The arts are still under. Want to talk about that?
So there is some guidance put out by the Massachusetts Music Educator Association that Gwen Chapman, our director of Fine and Performing Arts, and I have been going back and forth about. There are obviously some best practices that have been learned from that over the course of the past year. There are, you know, some things that I'm looking to keep in place, the bell covers, spacing where possible, and all of that. So they have put out a set of best practices that they would like school districts to look at, and Gwen and I have been going over those.
Great, thank you. So just talk about that. So a couple things, just kind of where my thoughts are. Obviously, it's clear the statistics, the numbers speak for themselves on what the community wants. That's why we did the survey. We wanted to hear from the community. I don't think in any of the surveys we've done since the start of COVID, which again seems like a lifetime ago, we got as big of a response, which I thought was interesting. And I thought it was interesting kind of where they ended up falling, elementary and secondary. So I think, so it's kind of clear what the community wants. So that's one piece of data that we have to look at. To me, a couple other things. The data for the summer educational settings was important, and to hear what happened, because that was the first time we had students maskless that were near each other in close contact. And then also the community numbers, right? Because, you know, I can tell you this, the first time I got my email again, that I hadn't gotten about a week, 2 weeks, whatever, and the number wasn't a 1, it was like a 6 or a 7.
Hey, it was a great day for me too.
Yeah, it was great. But my first call is, you know, to Aaron saying, okay, how many of your kids, what's the issue, what happened, should we be worried? And so when we start to get into the numbers and some of the data that's been shared here and some of the data we've had in conversations, you know, it tells me a story that the numbers don't tell you right off the top, right, of where the spread's happening and how it's happening. And then the last thing, I'm struggling, I've told a few people this, the part I don't understand, so we've been going through this for 19 months, right? If I do my math right, 18 months, whatever it is. No, 19, because it started in February of last year, the daily phone calls. The 3 entities that have the power to tell us to do masks aren't coming forward. Even the governor yesterday, he said, okay, I'm still not changing my mask mandate, or my mask guidance, although that could change. And then they cited why, right? High vaccination rates, low spread rates, or low positivity rates. So if they're not saying it, and I can tell you this, they're a lot more qualified to determine if somebody should be wearing a mask than I am, right? I've been doing this stuff a long time. And there are some things I feel, I'm pretty confident when I make a decision. Most of the other times, I'm asking an expert. In this situation, the three experts that I would look to, and I've read believe me, I've read the CDC, I've read the American Academy of Pediatrics, I've read DESI, what they gave him, which hasn't been much, which is unfortunate. That's the only frustration I will say. And I read what DPH has, and none of it is saying that they're highly recommending it. So I don't have a problem highly recommending it, but they're not mandating. And if they felt strongly, why wouldn't they? And those are the doctors. So that's where I'm kind of sitting. If they're not coming out, why? Because they're looking at the Commonwealth, and the Commonwealth numbers are probably in certain areas. I think you mentioned Randolph earlier. They're higher than us. What's driving them higher, right? And if they're that high, why isn't DESI saying communities with a spread of X or that? They're not. They're saying just highly recommend. So that's kind of where I'm sitting, is kind of let them be the experts and let's follow what their directive is. That's what we've been doing since March 13th. Or actually after March 13th, because we closed before the state told us we had to. Correct. That's another story. So that's kind of where I am. So at this point, does anybody else have any other thing they want to say, questions, comments, or does anyone want to make a motion? Again, there's a couple of different motions that would make sense. I lost my note with that note.
If we make a motion to follow the DESI guidelines, we don't have to. Did I hear that right, or do I do it back?
If you follow the DESI guidelines, it would be no masking, which would be in line with what the superintendent recommendation is.
Right. So
Do we have to do that as a motion? Is that what we're there?
the motions that I see, which differ a little bit, I think, from what you have, Mike, we do have a masking policy on our books. As you referenced, it does have dates in it. I think the cleanest motion might be to rescind that policy if the purview of the committee was to have masks highly recommended.
I don't think the policy is in place, but if you think it's clean,
Right.
we'll rescind it. We'll rescind and follow DESI guidelines.
That would be what I think the motion is.
Do you have the policy name?
Oh, jeepers.
I found it
EVCFA, I believe.
I found it pretty quickly
but
the other morning.
Let me find it. Sometimes Natalie's faster than me, so I think it's EVCFA.
You can actually Google Pembroke Public Schools mask policy and it comes up. I thought we were gonna have it in the packet.
Me too. EVCFA, I got it right.
EBCFA.
Yeah.
So if you want no masks, you would vote to rescind policy EBCFA and follow the superintendent recommendation to follow the DESI guidelines.
Correct.
That's what you're looking for. So that would be the motion if you don't want masks.
I will make that motion.
So that motion is by David. Is there a second?
Second.
Is that Susie? Is there further discussion or comment?
I would just sit there and say it's not going to make everyone happy. I think it's the best possible solution for Pembroke, is how I look at it. It's for Pembroke. Again, to some individuals, I will apologize in advance.
I mean, I think the peanut butter analogy is really strong. It's just one of those, when I'm looking at everything else. So, any other comments?
Other than Mike, I looked at the same documents you did and felt like if they weren't good, the experts that have spent a lot more time on this than I could possibly, I have to agree with their recommendations.
Further discussion? Okay, all those in favor? That's an aye.
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 Opposed?
You have to do it individual?
Nope, unless you want to.
No.
Unless I hear a no or an abstain.
Aye.
So let me do it again. All those in favor?
Aye.
Opposed? Abstained? It is unanimous. Okay, so the next one is, do we want to implement the test to stay program? And if you have questions on that specifically, we can bring that back up. But that would allow people in close contact to remain in school based upon test protocols or come back
My
early.
recommendation is that you conceptually approve it, and then when you guys meet again, I can bring you every single piece of the protocol. This gives us opportunity to get the ball rolling, to get the test ordered, to get our nursing staff in a position to administer the test as early as the first day of school if needed. I do think you guys are meeting once before school starts. Up to you.
I like that idea. I'm hearkening back to when we were going to do the pool testing, and there was these shifts were moving. So I'd like that option to look at more of the detail, so that we implement it and we're ready to really implement it if that's where we go. Does that make sense?
So is there a motion to conceptually approve the test to stay protocol for,
As outlined by DESE.
as outlined by Desi?
So moved.
So that's by Susie,
Second.
second by Lance. Further discussion on this one?
No, this provides options, right?
Yep.
So
Right.
parents and
It's-
families
it's
will have an
optional for
option
parent consent, yes.
of what to do, whether it's quarantine or whether it's
Correct.
testing instead.
Yep.
So I think that's important.
Okay. Anything else? All those in favor?
Aye.
Opposed? Abstained? That is also unanimous. So that means we are done with 7A. So anybody who wants to stay, you can. You wanted a quick break, but can we just do the, you're here for the, I just realized, you're here for the release comments. You're here for the, you're here for the letter on the 40B project, right?
Yes.
Yeah. So sorry, I didn't, Mario, apologize. Anybody wants to know?
Please, I think this was a very educational. I think you guys, for somebody that doesn't have any kids in the school system, who is passively has a strong opinion. Sure. I thought this was one of the best displays of town government open-mindedness approach that I've seen.
Thank you, appreciate that.
Mr. Chairman,
Yes.
I will be excusing myself if we're done with the health portion of the evening, but I want to remind folks that my inspections of the school system will not stop, because the safety of your children is my top priority as far as the sanitation and everything else, and I know not everyone's comfortable either A, coming to a meeting, or B, speaking in a public setting. Reach out to me. I have a very positive relationship with the school administration. I will advocate on behalf of your child. I know there are some special circumstances and everything else, but I will help in any way that I can.
Thank you, Lisa.
Thank you.
Lisa.
I look forward to our daily call tomorrow.
Okay, so on the agenda was, we did receive a communication from Baker, Braverman, and Barbadoro, Italian name, with regard to our letter on the concerns with the River March project, the 40B entity going off of Water Street. We sent a letter, people remember, after a couple meetings ago, with regard to our concerns with the project. Mainly the impact to North Pembroke School and the biggest impact to transportation. Their response said that they would put a sidewalk up to Water Street for a bus pickup, but to me, that is not practical because we do door-to-door pickup on kindergarten.
Yeah.
And they also-
Correct. There are, so at like Pembroke Woods, that housing development, we do a group stop for kindergarten because it is apartments as opposed to freestanding townhouses or single-family homes. But we do door-to-door pickup, but there is that one exception at Pembroke Woods as a development.
And
So
they didn't address all of our concerns.
no, so our main concern was about enrollment implications.
And was there ever, that's what I was like, what happened to the enrollment board? And I looked at, I think we had on file the original letter that went, not
Right,
the
and
second one.
and I sent the updated letter
Yeah.
that you all had discussed at your meeting. I think it was in actually the end of May or beginning of May.
It was a while ago.
I
It was in May. It
Yeah.
was in May. It was that long ago.
Yeah.
And it seems as though they have picked up the concern associated with the width of the street and bus pickup, but we have not gotten a response around some of the enrollment implications.
So can we do this? Can we respond to their letter, asking them to respond to our other concerns? And are we okay with the way they want to do the bus pickup?
I can't figure out
I can't either.
where it is. I don't even.
I'm glad you can't.
I can't. Maybe I'm just blind. I just.
Building 3?
I need better glasses or something.
It just seems to me, regardless of where the stop is, and I know it's a pool stop, it seems to be a long way for somebody.
Yeah, and that's, it seems like they were worried, like you said, about just the buses passing through. They seem to focus on that, but they've missed the point that under a certain age, you might go house to house to house.
Right, but just to be clear, at Pembroke Woods, we do pick up in a central location for all students, which is.
How many buildings though?
Which to me is building 9.
I don't know how many buildings are at Pembroke Woods.
So if you look at the diagram,
That would make
and
more
I'm
sense.
holding it sort of the way it was in my packet. Actually, if you look at the way it was drawn, so you have the logo at the bottom, building 3 is top right behind, right in front of the extended dry detention basin.
Right.
That's
It is
building
that
3.
way, right.
We have a youngster, kindergarten, first grade, second grade, in building 13 or building 14. Unless these buildings are the size of small houses, that's a pretty long way to go.
Yeah.
It looks like they're trying to avoid the bus going into the development. I can't think of anything else.
Right, it's
But-
widest right there at the
It's
beginning,
widest right there, you can do a bus turnaround right there, but it doesn't solve our concern about busing.
And
Am I
might
miss-
get parental cars. I mean, I know what happens in our neighborhood. We all drive our kids down, keep them warm in the car till the bus comes.
Right, when it
So
rains,
there's
yeah.
a clearance issue anyway. They were my thoughts.
So can we explain that they didn't address our busing issue? And they also didn't address our enrollment questions?
I will put together a draft and
And can you do me a favor, or unless somebody disagrees, can we copy the ZBA and the board and the select board or town manager on that? Because they also said a member of the ZBA and public inquired whether there could be multiple bus stops inside the developments. This could also alleviate some concerns, but they don't, it is a possibility, but it might not be because of the width of the road.
Well, I think, could I ask the question? This is cute, but unless I have like a microscope, I can't read any of this stuff. Is it possible to get someone to maybe come here, do a presentation? I don't know if the street is, 20 feet long and 20 feet wide, or, I
Right.
mean, dimension, to me, this means nothing.
And is this still
I'm sure there's a little
hypothetical?
graph down here in the corner that tells me that the green line is this long or whatever, but when they did the rec center thing, they kind of came in with a bigger presentation and said, okay, this.
Let's put it this way, I'm not an architect, but some of these roads are narrower than others, unless I'm eyeballing it wrong.
And like Susie said, with a school bus with a parent parked on the side of the road to drop the,
Yeah, because you
I
have
think
that
we got a
one
bigger
building,
liability.
you
Right now
have that one building tucked away.
And this hasn't been approved yet, right? This isn't
Yeah.
final?
I will reach out to them.
Correct?
Please do.
Yeah,
I
I've
haven't
got
heard
more
of that.
questions than
I
Do
answers.
you
thought
have
it was
questions
still
or others?
hypothetical.
I know you were also for this, but I didn't realize you were also here for this too, but do you, either one of you have questions or concerns that we should ask that we haven't?
Well, I didn't read the school committee's letter to the ZBA, so I don't know what you said on enrollment.
Sure.
One of my concerns is there have been, a number of different, as far as enrollment goes, there have been people, we were at a ZBA meeting the other day where they're still calling it a 55 plus community, which of course it's not.
It's not.
It is 3-bedroom and 2-bedroom townhomes, mostly 3-bedroom, 80% of them are 2-bedroom. The width of the street is 20 feet. When they added the sidewalk, so if there was a concern when it was 22, it has been shrunk to 20 feet. The developer doesn't give a lot of this information when they tell things. To your point, there is no final plan at this point.
Right.
So I don't even know when I started talking, if you had asked me a question or
No,
not.
no, I was just saying, was there a concern that did you have a concern that we didn't raise? Oh, sorry. Is there a concern with, because so our main concerns are on enrollment and transportation. It's clear that a bus has to get into the development to do pickups. I don't think anyone here, tell me if I'm wrong, feels comfortable doing a pickup at the front of the development because this development looks fairly deep.
Right.
Yeah.
Especially if we're talking, right, high school, that's gonna happen. It's
Yep.
just the way it is.
But the young ages, it's
Elementary,
concerning.
kindergarten, they have to go into the development, even if it's group bus stops, there's multiple. So our concerns around ability for us to pick up students, pickup and drop off, and the potential enrollment impact on North Pembroke. So is there another school type concern that you have that we should be raising?
I would bring up just the traffic concerns as a whole for transporting the kids to and from school. And a lot of that is centered around the intersection entering into the neighborhood that goes into the development.
Yep.
Of course, inside the development, you have a lot of the concerns that have come up at the ZBA are not necessarily school, but you have that with the school bus. They're very narrow streets. It's a mousetrap with very congested lanes of traffic. So, no, there aren't other issues outside of the two you mentioned, and we have a strong opinion on the safety of all residents entering and exiting, whether it's cross water, cross church, or water church, or water, whatever. Anybody that knows the area.
Either of the intersections at either end.
Either of the intersections, and for that matter, the intersection inside the cross in water and cross is another blind curve that is part of the whole.
Yep.
So that would be the one addition to the two that you mentioned.
Okay.
And I don't know the enrollment numbers. I'd love to hear them if it's not.
Right, and so that was, I think, part of the reason why we were inquiring is because when Pembroke Woods was first proposed on the current site, I believe they said there would be a net effect of 7 students to the school district. We have upwards of 55 to 60 students coming out of that district, out of that development in any given year. And so, yes, our enrollment has been flat for the past few years as a school district. Encompassing 55 to 60 students at North Pembroke Elementary School would have a severe impact on class size and staffing resources that were necessary. So we asked if they would do an extensive enrollment projection for those developments because, as you said, they are 2- and 3-bedroom townhouses. So in most instances, we'd expect at least one school-age child in those settings.
So who do you ask to do the study?
We asked them to provide us information that they had done around enrollment studies. Their attorney, so the representatives from River Marsh.
Yeah, because so the way we have to do is we have to put a letter to the ZBA, and then the ZBA raises a concern, which they have the ability, to respond to, and they responded directly to us. So in looking at the letter, they did not respond to the ZBA, so I want to make sure our response in this letter gets to the ZBA.
Yep.
Well, it is a true statement, and I don't want to bring in a lot of different things that aren't the school board.
Yep.
But trip generation, school generation. It's all when you look at a multifamily townhouse category for example, traffic.
Mm-hmm.
It's the same as a low-rise apartment building in Quincy next to a T. Okay, which obviously is going to if they do it in the same capacity where they take a general number, they say what is 56 townhouse / apartments going to generate. The developer, I assure you, will not adjust those based on the specifics of this development. Kids can't walk to the school. There's no public transportation. There's no ride sharing. You can't ride your bike down 139. Things like that. So I'm hoping when you get that information that we'll be able to, that it'll be published. The town has done a great job publishing it on most of the stuff on the, be able to see it. So we
absolutely. Anything we get is public record. So any communication they give to us is public record. Okay. So this letter we could share with anyone who asks for it.
Yeah, I'm surprised we haven't seen that on the. I check daily, and I haven't seen that on the town website yet.
Yeah, because technically we didn't receive it or acknowledge it until tonight's meeting, so it'll get to. Yeah. So.
So we would have a problem getting in and out of our house, but other people passing or trying to pass would get stuck behind that bus or.
They're proposing the bus stop inside the development. So they're proposing you come in off of Water Street, I don't know what number it would be. You come in off
74
of Water Street, you pass one building, and it's on the second building. You know, I know this is tough, especially for people at home trying to follow. We'll get the letter posted to our website tomorrow.
This is a paper copy if you want it, because
Yeah,
it's
you can
public
have it.
record now that
I thought it was under our understanding that the roads in there do not have any turnarounds, and they're too small for even emergency vehicles.
Yeah. Let me, because the letter's short. This letter's, I'll just read this second paragraph because it just tells who they're representing. This letter is in response to comments raised at a public hearing on August 3rd, 2021. As set forth on the enclosed color rendering, we have proposed a school bus parking area across from Building 3 with a sidewalk leading to Water Street for bus pickup. A member of the Zoning Board of Appeals and the public inquired as to whether there could be multiple bus stops inside the development. This could also alleviate some of the expressed concern about school buses on the narrow Water Street. Please let us know if this is a possibility, and if so, who would be the best person to speak to about the location? Thank you for your time and consideration.
Right, but that's
So-
leading to Water Street. So the bus would be on Water Street, and they would walk to the bus.
Well, he's
From-
saying,
from their pa-
well,
with their parents.
He's saying that they'd park in
No.
front of Building 3
yeah,
as
in
a
Building
stop.
3.
Right,
He's saying
they're
that,
in front of Building 3, but they're gonna walk to the street.
he said there
That's
would
what
also
bus-
be a sidewalk if they wanted to walk to
They don't wanna build anything, they don't wanna build any
yeah.
sidewalk.
Either way, what our response back to them is not going to be anything about Water Street. It's going to be about the need for a bus stop somewhere in the back half of the community at a minimum. And for that, we would have to tell them how much clearance we would need to turn a
You don't
bus
see anything
around.
on that diagram, do you?
No, I don't. Is you look, some of the roads up here, I'm gonna go up here, narrower than others. So, like, it looks like I could come down one way in front of Building 5, maybe, whatever it is, but it looks like there's a parking area probably in front of it, and I don't know how I would turn a bus around it. So, that's what we need to make sure they understand where our concerns are, and we need to make sure the ZBA understands those concerns. Everybody okay with all that?
Yeah.
Yes.
Yeah,
So-
we need more info.
Awesome.
Well, obviously, it's a safety issue for the children as well.
That's
Yes,
it,
sir.
yep.
With every, car, truck, or whatever that wants to go in there.
Oh, absolutely. That was our concern from day one, and I think we expressed it on the initial application, and we reiterated it when it was made, just how time flies. When we sent the ZBA a letter before one of their hearings.
Right, so we sent a letter on January 19th of 2019, and then we resent a letter on June 9th of 2021.
Okay,
with
so
those same
when
concerns.
you get the response from their attorneys,
Yeah.
we will also be able to have the response.
Yep.
this
Yep,
public-
so it would show up
so
as a
our attorney can
communication.
dispute
Yep.
What they're talking about.
Yep, so in this situation, we'll put this letter up on the website. We'll also make sure the ZBA has this letter, because they're the authority over this. We can't say yes or no to it, right? We can only, all we can do as an elected body is express where the concerns are. Individually, we can do different things, but we can express where our concerns are as a body, and then communicate with the bodies who have authority over the
Right.
making decisions.
Fully understand.
Fair?
Thank you.
Okay, no worries. Okay, we good on that? Did you want to take 5 minutes?
Yes.
So what we're going to do is it's 9:22. We're going for 2 hours, 22 minutes. Erin asked if we could do a quick recess, so let's re-adjourn at 9:30 for those of you still with us at home. So 9:30, we'll come back on. Looking at PAC TV? Awesome. Thank you. We'll be right back in about 8 minutes.
The bathroom break.
All right, we're back after a short recess, so appreciate everybody staying on and joining us. So rest of the agenda. Bill's schedules are circulating. So I'll take a motion. We have 2 sets of minutes. So is there a motion to approve the school committee minutes of Tuesday, June 29th and Tuesday, June 8th, Tuesday, July 13th, sorry.
So moved. You got it covered.
So motion by Sue, second by Lance. Any further discussion? All those in favor?
Aye.
Opposed, abstained, perfect, so that is item 6. So PCMS surplus material, there was a list in your packet of PCMS materials that they would like to declare surplus.
I would be excited if you wanted to work your whole way through my entire report. That's great.
Okay, so is there any concerns on various textbooks at the middle school that need to be declared as surplus? We have to approve textbooks as surplus, actually have to approve anything, but there's no useful life and they cannot be, can they be donated?
Yep, so what we do first is try to sell them back to the publisher. These books in particular, they're not buying back because they are so far out of date. We do then look at donations. Sometimes the library will take a copy or two of the book. Some of our, I think it was Connor Giese that made the Pembroke little free libraries that we have on our playgrounds. We do place some books in there as well. As when you deem it surplus, it's allowing us to dispose of it in the manner in which is best fit. So in most cases with our textbooks, it is recycled, but there are times where we've given copies. We do reach out to the Council on Aging to see if they have any interest in some of the materials as well. But we do first try to sell them, then we donate them, and then when there's no other option, we do recycle them.
So is a motion to approve the PCMS surplus materials as presented?
So moved.
Seconded.
Motion by David, second by Susie. Any discussion? All those in favor?
Aye.
Opposed, abstained, that is unanimous. Now, consideration for approval, and we'll have to waive our policy for a first read for handbook revisions for PHS and PCMS.
And the elementary handbook. There are no substantive changes to the elementary handbook, just updating. So school committee members, term dates, that type of stuff. There's no other handbook substantive changes. I did send along to you in your packet. We did not print out the extensive handbooks, but in your packet there is a copy of the redlined elementary handbook.
So is there a motion to approve the handbooks for the Pembroke Public Schools for the 2021-2022 school year with amendments as presented?
So moved.
Seconded.
Motion by Lance, second by Sue. Any further discussion? Go ahead, David.
The middle school handbook, Pembroke High School, we on the high school one for this. We had a question here with the
So that's
distributing.
Yep, that's the Pembroke High School handbook. So just to clarify, the Education Subcommittee did meet last night to take a look at these changes as well. There are 2 substantive changes to the high school handbook. One is on page 39. It is just an addition of language that outlines the possession of or dissemination of sexually explicit photographs or videos, aka sexting. The language that's added is just to clarify that purely being in the possession of it, whether you are the creator or the distributor, is a code of conduct offense. So just clarifying for students that, a lot of times we're talking about Snapchat videos or TikTok videos and, I didn't make it, somebody sent it to me. And so we want students and families to know that just having possession of it does reach the bar for some of this stuff, and that is outlined in the handbook. On page...
Yeah, in our discussion yesterday, it expands the verbiage to allow discipline and to help support the administration in dealing with it.
No, my question's actually on the next one that we tried, says distributing and purchasing is in red.
Yep, so purchasing is the new addition. The words
Right,
distributing already exist.
I thought we should probably put the word intent in there somewhere, with intent to purchase or distribute.
So
'Cause that covers us, I think.
This language as it stands covers what the bandwidth of the high school administration is to investigate instances of distributing or purchasing alcohol. You'll see under number 9 that refers to marijuana and other prescription medication. So the intent to purchase and the intent to distribute, I would say to you, from a legal standpoint, the bar is on us to prove that that has happened. And we did run these handbook adjustments by our legal counsel. And Joe Emerson, who represents the school committee, his recommendation was distributing or purchasing of alcohol and illegal substances. And when you get to number 9.
The way I understand that law, distributing, purchasing. Yeah, Joe said it's okay. I happen to teach a course on this, so I'm
right. School buildings are a little bit different.
Right.
So what happens more often than not is that the act is, as you can see from the explanation that Mark has put here, the act is almost often headed off by administration before it even happens. And so there has been several instances of conversations with students and families related to a series of text messages about potential interaction or sale or distribution of alcohol or illegal substances.
And David, too, there's sort of that double lens, right? Because there's school discipline and then there's police matter.
Right.
Right. And police matter will always take over and follow the rules that you're now discussing. We're talking more on the discipline and how it's handled from a school standpoint.
Yeah, I can see the parent arguing that, hey, he didn't do it. He was thinking about doing it, but he was thinking about jumping off a bridge. He didn't do it. He was thinking of,
right, and that bar is the same for a lot of instances in our
Yeah.
code of conduct, threats, bully, all of
Yeah, no, okay, I just, from the legal standpoint, I hate to say in the course I teach, it's kind of weird. It has to be intent and then the penalty under the law, and
If you go to the MIA rule, it's in the presence of, so it's even so if there's a party in the library here, kid over there across the library has alcohol, and I'm nowhere near him or her, I'm guilty because I'm considered in the presence of by the letter of the MIA rule book. So it's to Eric's point's a little bit different, or Lance's point, a little bit different between what the law is versus what school code of conduct is.
Okay. I'll go with you.
So those are the two substantive changes to the high school handbook. The middle school handbook has a couple of formatting changes that are outlined on that summary. There's also a couple that I think are important to say out loud if anybody is still listening at 9:36. So the recommendation of the administration at the middle school this year is for students not to be assigned lockers. So what we learned, thank you COVID-19, is that when students are responsible for carrying their materials with them, they are far more prepared for class. So we've talked a lot about executive functioning and what that looks like in boys a lot of the time, but our teachers and our staff at the middle school were pleasantly surprised on how classroom ready students were when they were responsible for carrying their own materials. So we are recommending not using lockers at the middle school again next year. I think the only other big one here is some changes to the dress code. So what you have on that summary page is the bullets that we'd be removing from the existing handbook. What this does is focus more on the goal of a dress code, right? So the goal of a dress code is to prevent disruptions to the learning environment and take out some of the more gender-specific details, such as, how thick is your spaghetti strap? More about, dressing, body awareness, and whatnot. I have a middle schooler now, finally, and many of you have had one. It is a very awkward time for boys and for girls at various points in that, and we want to make sure that the focus for the dress code is about, not being a disruption to the learning environment. And some of the language we had in there was a little bit old.
Yep. No,
So-
good. Thank you.
Any further discussion? All those in favor?
Aye.
Opposed, abstained, handbooks are approved. So now, consideration for first read. We talked about this in budget the other day. So for the ESSER 3 grants, waiting for ESSER 4, part of the grant approval process requires us to survey the community. And this was a survey that we looked at Budget Sub, that we would need to get to the community, get their feedback, and then you use for consideration and spending of the funds. So this is a first read. We'll take it back for approval at the August
31st meeting, and then obviously release it when school starts, get it back, and we need to have all this done in the October timeframe.
By October 4th, yep.
Okay?
Okay.
Any discussion on this? So is there a motion to approve as a first read the ESSER 3 stakeholder survey?
So moved.
Seconded.
So motion by Sue, second by Susie. Can't-
Yeah, that's,
Yeah, it was a little
we
bit
shouldn't
tough,
allow
but
that.
that's okay. All those in favor?
Aye.
Opposed, abstained, perfect, unanimous. One of the second to last thing we need to talk about is the Administrator FY '22 salary grid. So this sets the grid for administrators, principals, curriculum coordinators, assistant principals, or curriculum supervisors. So this sets their salaries for the next fiscal year or the next school year. Fiscal year has already started, so some of these things would be retroactive. So is there a motion to approve the grid as presented?
So moved.
Second?
Motion by Susie, second by David. All those in favor?
Aye.
Opposed, abstained? Beautiful. Okay, now, fall town meeting warrant. We are going to be putting 3 articles on the warrant. The first one we talked about when we did closeout, which would create the Special Education Stabilization Fund. That would allow us to put monies into the Special Education Stabilization Fund as a rainy day fund in case we had a high year of special education costs or a large increase. We've had a couple in the past. It would allow us to put in some one-time revenues that would take out for one-time expenses. Money has to go in based upon town meeting. Money comes out based upon a vote of the select board and the school committee. So that's the controls. So we would be putting that article on the town meeting warrant. The second corresponding article would be to fund it with $150,000 from free cash. That's $150,000 of the monies that we returned because we reused some of the ESSER funds. So we need a motion to put this on the town meeting warrant. The select board is reviewing the warrant tomorrow night, I believe.
Right, so I already have, we've had conversations and there's already a placeholder in there for this, but, in speaking with Sabrina, it does seem as though this can be one article, the creation and funding, the initial funding of it. So, you would just be allowing me to submit the wording that we're looking to be posted, printed in the warrant for this in particular, this article.
Okay. So there is a motion to submit 2 articles to town meeting with regard to establishing and funding with $150,000 a special education stabilization fund, actually with $150,000 coming out of free cash based upon the school committee return of funds.
So moved.
Second.
Motion by David, second by Sue, quietly. Any further discussion? I know we talked about this at the last meeting.
Weren't we going to do a third piece tied to something else?
So there's 3 things, right?
Okay.
Let's get those 2 done. We're
Okay,
gonna get
all
to-
right,
yeah.
gotcha. Okay, thank you. Then
Good. Any further discussion on that? All those in favor?
Aye.
Opposed? Abstained? Unanimous. Okay. So the third thing, we talked about a long-range planning. That's what Susie's talking about. So we're looking for, you have in front of you our plan for renovations of the fields. And also with regard to the Hatch building. So there's a couple of things going on here. One is to submit articles for what would be phase 2 and 3 of the, actually phase 2, phase 3, we actually have phase 4 too, right?
Right, but I think this year we'd be submitting
Yes,
phase 2.
okay. Yeah, so to submit a CPC request for $75,000 for renovations to the varsity softball field in the beginning of the renovation of the varsity baseball field. We used to have a baseball field at the high school, for those of you who don't remember. It has now been grown over, and we would like to return high school baseball to the high school campus. Matakeesit's a wonderful field, but that would allow us to shift junior varsity to Matakeesit from Lagoon, which is in rough shape, and then move varsity to the high school and allow it to be on campus. So if students wanted to go see a game, it's a lot easier. So students, both varsity and JV, if they could, depending upon what the coaches do, they could practice out on the field, on campus. They wouldn't have to transport. It's a much better environment for them. With regard to softball, as a father of a former softball player, the girls' varsity softball field, we were lucky to get fences and irrigation after some significant damage, but there's still work to be done to bring the women's facility up to the same level of the men's facility, and we're looking at, with the $30,000, additional work on the grounds, but also dugouts. Youth softball uses those fields also, so it would give them something on par with what the boys play. So we would go with the $75,000 for the varsity softball, varsity baseball field. To make a decision on Hatch.
Yep, so I put in the packet that I had sent you a CPC application for $15,000 to have a study done at the Hatch building to look at what the potential renovation cost would be there. I know that I've shared with you all, and I am happy to take you on a tour. I'm just waiting for the weather to be less hot in the building. There are extensive needs, and I think, you know, the sentiment of long-range planning was we should probably get a better idea of what we're getting ourselves into once we start to repair. So we don't want to just replace the boiler and have X, Y, and Z happen. And so I don't have necessarily the background to tell you that this is a $250,000 project. You know, there are a couple of experts that we have had the good fortune of having in town. I know Mr. Van Riker, prior to passing away, was a huge proponent for doing some work on the Hatch building. Alan Peterson, you'll remember, who did work for us for a period of time, you know, was willing to, from a structural engineering standpoint, take a look at the Hatch building. We do need somebody to come in and give us an idea of what type of renovations and what the scope of it would look like. So $15,000 would be enough money to get that study completed.
Yeah. Rather than ask for money and paint it, rather than ask for money and abate asbestos, rather than ask for money and do a roof, and then find out at the end, we're just putting money and money and money. Let's figure out what the total cost is, then determine if it matches what we believe we could use it for. Now, there are uses that we talked about, potentially a transition program for the high school, and potentially tutoring center. There's lots of different things we could do there, but before we even consider that, it makes sense to find out if the building is worth saving at this point. After the $15,000, we get a number that's too big, then we have to make a different decision, because that building was deeded to the town for the purpose of education. So we have to find out from council what we can do.
Right, it's deeded specifically to the school, not to the town, because we did have a conversation a few years back about giving it back to the town, and it isn't worded that way, but you know, once we have an idea of the scope and the magnitude of the cost, I think we would have to have a larger conversation with the town, depending upon what that is.
Only thing I would piggyback off the location of the new community center and tie in programming and the ability to do joint stuff together. It's got great possibility.
It definitely does. The question is it a $200,000 repair, or is it $1 million repair? And I think it's probably somewhere in between, but which is it closer to? And I don't think there's anybody who knows. We have to spin a wheel is the best way to come up with an estimate right now without getting somebody to spend some time in that building. Somebody who's not afraid of rats.
Not us, guys, not us.
Yeah. So is there a motion to approve the submission of the CPC articles?
So moved.
Second.
Motion by David, second by Lance. Further discussion? All those in favor?
Aye.
Opposed? Abstained?
Right,
Perfect.
so there's a process to CPC. We submit the application to them. They do invite us to come to their meeting. They can ask us questions and whatnot. So I will keep you guys informed of when we're invited. And if anyone wants to join me, I'm happy to have you with me. I know the last time when we presented the first phase of the field plan, Justin Domingos, our athletic director at the time, joined me. I'm sure Brian is happy to participate in those conversations as well. So there is a third piece, like Susie was talking about. So the other funds that we returned to the town, we talked about earmarking them for HVAC repairs. So in conversation with Town Hall, I think the cleanest way to do this is to request a capital item on the fall town meeting warrant for the 2 HVAC units that we talked about, and identify the funding as funds that we returned.
You bet.
That's
So
the cleanest way to do it.
do we need to?
You just need to authorize me to submit an article as such.
Got it. I thought so. Okay. So is there a motion to authorize superintendent to submit another town meeting article for 2 HVAC units, which would be funded by free cash that was returned by the schools at the FY21 closeout?
So moved.
Second.
Aye.
Opposed, abstained. Thank you, everybody,
That's my bedtime.
tonight, and thanks everyone who did come out. Great discussion, and thanks back to you for being so late.
Son's been going to camp this week.
Oh,
My wife.
nice job, Mike.
And
This
then
one
he's
might
had
go.
football practice.